Amruta Kalashahastaya, Sarvamaya Nashanaya, Trailokyanataya, Vishnave Swaha. Then have the blessings of all Gurus, Guru Brahma, Guru Vishnu, Guru Deva Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. With the blessings of all Purva Vidyas and Apurva Vidyas, I will share my experience. They told me to have sharing experience of Madhumeha. Here, instead of only Madhumeha, I will share the experience of treating diabetic foot gangrene ulcers also. Basically, I am a surgeon, that is why surgical condition and medical condition both I will share my experience. So now, you see, here some cases I will show you. You see, it's a very swelling, acute swelling with diabetic foot gangrene. Whole up from here to here, everything edematous. Next, please. With the gangrenous foot. Next, please. Such patients too come us. Why they come to Ayurveda? Why they come? They go to modern doctors first. They see the patients. They advise them to do below knee amputation. Why they come to us? Some herbs to increase the production of insulin, to decrease the resistance of insulin. Like that we think. Usually they come and ask also, Doctor, sugar kadime adu maddu kodi yavadu agbodu. They don't know about anything about Ayurveda. Usually we also tempted to give some drugs to increase the production of insulin, to decrease the blood sugar, that and to heal the ulcers. Symptomatically we usually think and we give. How it should be treated according to Ayurveda. Next, please. So, what do you mean by Ayurveda? What is meaning of Ayurveda? Ayushaha Veda. Ayusha means life from birth to death. What is the meaning of Veda? I know you will tell it as a science. Science is translation, not meaning. That's the difference between translation and meaning. Veda means with vijnani. With is mula dhatu. Vijnana means vivechita jnana. Karya karana vivechita jnana is here. Karya karana vivechita jnana about Ayusha, some life from birth to death. That is why it is Ayurveda. The person who does karya karana vivechana is known as Vaidya. You are all Vaidya because you are doing karya karana vivechana about life. That is why you are Ayurveda Vaidya. Next, please. So, this basically the concept is you are doing karya karana vivechana. That is cause and effect analysis. Even Western science also based on same concept. There is no difference. Concept wise there is no difference. Now what is the difference? Difference is which logic you use for karya karana vivechana. In Western science, the logic used is biochemical activity of a single cell. If biochemical activity of single cell is deranged, that is pathology. To correct some drugs you give acts on target cells, deranged biochemical activity is corrected. That is pharmacology. That is according to Western science. In Ayurveda, how we are analyzing? On the basis of three doshas. That is the logic we are using. That is why Sushruta says, Nasti rogo vina doshaha. What is yasma tasma vichakshana? The another meaning of same line is Nasti arogo vina doshaha. When rogas in samavastha, there will be aroga. When doshas are in vishamavastha, there will be roga. Anuktamapi, doshanam linga. Even it is not told, you have to do doshalinga in vyadhi. In the given vyadhi you see doshalingas, then give dosha vyadhi viparita chikissa. Karya karana viparita chikissa. Doshas are karana, vyadhi is karya. Karya karana viparita chikissa. Uktamapi, anuktamapi he told, uktamapi, even it is told in textbook, you have to see karya karana vivechana, dosha vyadhi vivechana in a given patient, not in textbook. I hope you understood. In textbook you by heart it, you know. Everyone will do analysis, all the things from morning to evening. But if a patient comes to you, you have to do that dosha vivechana in that particular patient, that condition. Then you have to give dosha, vyadhi, viparita chikitsa. So that is why the tridosha becomes very important. First, about 15 minutes, I will discuss about tridosha siddhanta, because that is very important understanding. I asked them who are the delegates. Usually, most of them are students are there and practitioners are there. It may look boring, but it is very needed, because today what happens, everyone bypass this tridosha. Bypassing tridosha, if a patient comes with diabetes, a drug is selected for anti-diabetic. Tridosha is not there. Sugar increase, sugar coming, you are giving a drug. But why? Which dosha? No one analyzes in a given patient. So unless you analyze this tridosha in a given patient, if you give a drug, it does not become Ayurveda, because Karyakarana Vechana is not there. Veda means you have to do Karyakarana Vechana. So that is why I discuss about this concept about 10 or 15 minutes. Then you will understand properly. What is this Vata, Pitta, Kapha means? What are needed? The Karana is told in Ayurveda is Dravya Guna Karma Samanya Vishesha Samavaya Etat Karanam Karyam Dhatu Samyam. What are Dravyas? Khadinyatma Manaha Kala Dishascha Dravya Sangraha Prithvi Apateja Vayu Akasha Panchamabhutas. This main Dravyas. From this Panchamabhuta with the Atma you get Sharira. Only Panchamabhuta is sufficient. Why? There should be Tridosha. I think everyone will ask you. Why there should be Tridosha? Only Panchamabhuta is sufficient. Right? You see, why it is needed? See, we are living now. Panchamabhuta is there. You can see Panchamabhutas. Everyone can see. But you can't see Tridoshas. Can you see Tridosha? You can't see. You can experience it. Now, I am a living person. Just why this Tridosha is needed, I will tell you. Just after death also, Panchamabhuta is there. Before death also, Panchamabhuta is there. Then what is the difference? Panchamabhuta is, if Panchamabhuta is sufficient, after death also Panchamabhuta is there. In living also Panchamabhuta is there. What is the difference? You are saying Atma is there. If I don't believe in Atma, what you will tell? If I don't believe in Atma, then what you will tell? I hope you understood. So, just after death, Panchamabhuta is there. Before death also Panchamabhuta is there. Then what he tells, what is the difference? In the Charaka Samhita, Sutrasthana 9th chapter, he says, Maitri karunyam marteshu shakye pritihi upekshaha praktisteshu bhuteshu. Maitri, friendship, karunya with the patient. Shakye priti, to whom you can cure, you have priti in him. Upekshaha praktisteshu bhuteshu. He tells the word upeksha, should not treat whom have praktistha of mahabhutas. What is meaning of that? Praktistha of bhuta means, when we are living, they are not in Prakriti state. They are in which state? After death, they are Prakriti state. Before death, they are in which state? They are in Bandhana state. Vayu and Akasha in Bandhana. Agni and Jala in Bandhana. Prithvi and Apya Mahabhuta in Bandhana. You are having Vata, Pitta, Kapha. After death, there is no Bandhana. They are in Prakritistha state. The word he used for Prakritistha state. That means before the death, they are in Bandhana state. That means your death day is Independence Day of your Panchamabhutas. Independence Day of your Pancha Mahabhutas. That is why you are celebrating it after death. So, they are in Bandhana state means what? Why Vayu and Akasha? What are needed for formation of Vayu? What is other needed? Do you think Vayu and Akasha is sufficient for formation of Vayu? Here it is moving, here it does not move. Why? Movement is moving force, Vayu. Why I can't move? Because there is no space. When Vayu and Akasha space in Bandhana, inseparated combination, inseparable combination, that is Samavaya. Dravya guna karma samanya vishesha samavaya. Samavayitu aprutak bhavaha. Aprutak bhava of Vayu and Akasha, then you will have function of Vata dosha. That is Vata dosha. It does all the function from birth to death. From conception to death. After conception, Vayu function is going on, all the movement is functioning because Vayu and Akasha in bandhana. When you die, that Samavaya is not there. Vayu and Akasha is there after death. So this movement function is going on. So for a formation of a dosha, there should be three factors. Vayu and Akasha is hardware, whereas Aprutak Bhava is a software. Then you will have this function is going on. Then for pachana of boiling of a rice, what is needed? Agni and jala. Do you think it is sufficient? Take rice in a bowl, then put on the stove. Can you boil it? What you have to do? It should be mounted on fire. Which one? Bowl should be mounted on fire, then only boiling will happen. That is aprutak bhava of Agni and Jala, then there will be pachana occurs. I hope you understood. That Samavaya is that much importance is there. That is a software. That is a software. Usually we don't think about that software. You think Agni and Jala is sufficient. No. There should be a third factor. This very important factor, that is Samavaya should be there. Prithvi and Apya Mahabhutu, but should be inseparable combination. You will have bandhana, shlish alingane. You can build a building, build a body. How a cell membrane is made up of phospholipids. Phospholipids are formed from food. From food you take by Vayu, pachana done by Pitta. Then all materials should be arranged in a cohesive matter, should be cohesion fact. A particular akriti, you will have a akriti formation occurs of a cell. Then cells attached, you get tissue is attached, a body should be in a particular akriti. That is why that factor is known as shlish alingane, shleshma. Whenever there is a derangement of this shlish alingana, the diseases are called as akriti variation, shleshmaja vyadhis like arbuda, galaganda, granthi, etc. When pachana variation occurs, these diseases are called as paitika vyadhis like jwara, atisara, raktapitta, runashota. That is pachana variation. When movement variation occurs, then we call these diseases as vataja vyadhis like pakshagata, sandhyastigata vata. Movement variation, madhumeha, everything. Movement variation occurs. I hope you understood. So these three factors are softwares when they work in presence of Atma. Why it is needed? You can ask why this Tridosha is there still. It is a software you can experience just like a computer. In computer, hardware is there. Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra, all hardwares are there. In that hardware, software resides. Where is software? Can you see the software in a computer? You can't see. Where it resides? In hardware. Just like that, Tridoshas are softwares that resided where? In hardwares. When the software works in a computer, just you switch off the computer, can you see the software? When they work in presence of electricity, Atma, just like that in presence of Atma, our Tridoshas, softwares, work in the body. Saptadhatu, Srimalas are hardwares. In that hardware resides Tridosha software that does all the functions in the body. I hope you understood. So this is three softwares are done by God that does work from birth to death. When death occurs, these three softwares are not there. When these three software are deranged, you will have different vyadhis. So a physician does a software engineer's work. Derangement of doshas are played. When hardware is deranged, a surgeon does the function, just like a hardware engineer. I hope you understood. A hardware engineer body is a surgeon and a software engineer in the body is a physician. So I think you understood. In the computer language, I think students will understand very nicely about Tridosha Siddhanta. So now, to understand this Tridosha, I will take this shloka. Samadoshamagnischa samadhatumalakriyaha prasannatmendriya manaha swastha ityabhidiyate. What do you mean by samadosha then? Samkarma kurvet. No, I want to this mathematical explanation. So, what do you mean by samadosha? Sama, vata, pitta, kapha is sama means what? Can you explain me? Vata, pitta, kapha, sama means what? So, how many vata, pitta, kaphas are there? How many are there? 5. That is types of vata, pitta, kapha. Vata, pitta, kapha, how many? It is sama to what? If I tell this pen or something, pen sama to what other? It's a relative word, It is sama to what? But something else should be there, A word of sama is a comparative word. So sama to what? That's how many is there? I hope you understood my question. Sama means sama to what? How many are there? You see this shloka, Dvidha vata adayah. Vata pitta kapha 2. Prakritaha, Vaikritascha. Prakritaha, Vaikritascha. Everyone learn this concept. But usually it does not go into your mind. That is why I am explaining you. Next please, next. I will explain you this one. Dvida vata adaya, prakrita vikrita asya. What is prakrita vata pitta kapha? Are causative factors for sapta vidha prakriti. Shari janma, shari dharana, dat samjna. 3 prakrita vata pitta kaphas are causative for formation of body. That does dharana of the body. It is called as 3 dhatus. Dosha ekam vikrana bija bhuta mumusho sthana chalanti. They are bija swarupa for dosha swarupa vaikrita vata pitta kapha. Mumusho sthana chalanti. These prakrita vata pitta kapha does not change from birth to death. When they change, that causes some lakshanas in the body, that is known as arishta lakshana, that is impending death. Next please. Arishta lakshana. Sarveshu dehe saniteshu prakrito ulbane padeshaha. Even though 3 vata pitta kapha are present in the body, according to prominence of vata pitta kapha, they are called vata prakriti, pitta prakriti, kapha prakriti, dvidosha and sannipata prakriti. Every person has 3 doshas, but each person does not have same percentage. Some person have vata more, some pitta and kapha more. You call it vata prakriti, pitta, kapha, dvidosha and sannipata prakriti. Next please. What is this? How much vata pitta kapha should be there in a given person is decided by percentage of, permanent combination of percentage of vata pitta kapha in father, mother, ahar rasa and kala. By this permanent combination, a new entity's prakriti is decided how much vata pitta kapha should be there. Actually this whole concept is a geometrical concept, mathematical concept. In a given circle, next please. In a given circle, if you do a triangle, vata pitta kapha. Next please. If human being is 46 chromosomes, you take 46 meter diameter a circle, have a triangles. How much? 800 billion people are there, 800 billion triangles. Circle is fixed, human being. 800 billion triangles. Each triangle is different, one to one, according to his prakriti. I hope you understood. This is unique to that person. Which one? Triangle. So this is geometry. Next please. If it is broadly, we are calling as vata more, pitta more, kapha more, dvidosha and sannipata. This is prakrita, vata, pitta, kapha in a given person. Some person may have vata, some pitta, kapha according to his prakriti. Next please. If you see, let's measure it. Next please. If you measure V plus P plus K, perimeter, 119 is sama prakriti. Next please. Ekadosha, it is least 110. You see, perimeter. Next please. Pitta, kapha. Next please. Next. Dvidosha, it is 116 in the middle. Next please. Next. Next. What do I mean to say that? In Ashtangradaya he says, Samadosha Shrestha, highest perimeter. Dvidosha Madhyama, middle. Ekadosha Nindya. This whole concept of three dosha is based on this geometry. A geometrical, mathematical concept on this base, whole Ayurveda is developed. When it is developed on mathematical concept, it is Anadi and Anantya. it will never change. If your concept is based on trial and error, by data based, it will change according to time and space. If you go to US, you go to Japan, it will change. But this will never change because it's a mathematical based concept. That is why Ayurveda is never change. Time to time, place to place. That is why with the deleting this tridosha, you can't practice. That is why I want to show this concept. I hope you understood. Now everyone will be interested. What is Vaikrita Vata Pitta Kapha? What is Vaikrita Vata Pitta Kapha? Next please. Vaikritastu garbhad abhinisritasya aharasasya malaha sambhavanti. Mother takes food, it pachana occurs, goes to baby, again pachana occurs. Malaswarupa kapha pitta vata forms. How much it should form? It should form up to the extent of prakrita vata pitta kapha in that particular individual. Swapramana. They are formed up to the extent of prakrita vata. Te khaladivashena swapramana vruddhiksha yoga deham anugruhya dushayanti cha. According to khala artha karma, after birth, you take the food from Madhura Vipaka, Kapha forms, from Amla Vipaka, Pitta from Kantu Vipaka, Vata forms. How much it should form? It should form up to the extent of your Prakrita Vata Pitta of how much? That is Swapramana. If Swapramana is formed, Anugruhya does all the functions in the body. Which one? Vaikrita Vata Pitta Kapha. Dushayanti cha, when Vruddhi Kshaya Yogat. If Vaikrita Vata Pitta Kapha increases or decreases, Dushayanti does all the diseases in the body. Which one? Vaikrita Vata Pitta Kapha. When they are in Swapramana, does all the functions. If increase or decrease, it causes diseases. That is why since this, if it is increase or decrease, it causes diseases, that is why it is called as dosha. Otherwise, they are doing all the functions in the body. Which one? Vaikrita Vata Pitta Kapha. Prakrita Vata Pitta does not cause. Prakrita tells this much Vata Pitta Kapha should be there in a given person. Bija Swarupa. That much percentage of Vata Pitta Kapha should be formed from food. How much? Prakrita Vata Pitta Kapha. This Vaikrita Vata Pitta Kapha does all the functions. Anugruhya does all the functions. Vruddhi Kshaya Yoga Dushayanti cha. So health means, Samadosha means, Vaikrita Vata Pitta Kapha should be sama to Prakrita Vata Pitta Kapha. That is Samadosha. I hope you understood. Next please. So if V plus P plus K is Prakrita Vata Pitta Kapha, V1 plus P1 plus K1 is Vaikrita Vata Pitta Kapha. Health means V plus P plus K equals to V1 plus P1 plus K1. That is Samadosha. Next please. So there is a physiological variation. I told if you see mathematically no person is healthy at any given time. Practically you are saying you are healthy, but theoretically no person is healthy. Why? Vayahu rautranta bhaktan teyanta madhyadiga kramat. In Balya kapha is more, Madhyama pitta is more, Vruddha vata is more. Morning kapha more, Madhyana pitta more, evening vata is more. That is Vaikrita Vata Pitta Kapha variations, physiological variations. This should be known for a Vaidya. Next please. Rogastu Dosha Vaishamya, Dosha Samyam Arogata. Dosha Vaishamya, Vaikrita Vata Pitta Kapha is varied. Vaishama occurs from Prakrita state. That is Roga. When Dosha Sama to that is health. So Kalartha Kramana Yogo Hinemithyati Matraka. By this one, P1, P1, K1 variation causes the disease. Next please. So next, Kalartha Karma Yogo Hinayati Matrakaha, V1, P1, K1 shoots the circle. Increase or Kshaya. Vruddhi Kshaya Yoga does the disease. I hope you understood. V1, P1, K1 may increase. Eka doshaja, if it is Dvidoshaja, all three increase. Sannipataja, Vyadhi can occur. I hope I am able to convince you about mathematical concept of this Tridosha Siddhanta. Vaikritastu garbhad abhinisa aharasasya malaha sambhavanti. Mother takes food, that gets digested, then goes to womb. Again there digestion occurs. Malaswarupa Kapha, Pitta, Vata forms at first. How much it should form? Up to the extent of Prakrita, Vata, Pitta, Kapha. Prakriti is Shukra Artava. That is Prakriti. Shukra Artava, this one. That is a fixed. That if it is various, that is a death. So Prakriti Vata never change. Up to the extent Vaikrita should form. Swapana, after birth, Kala Divashena. Kala Divashena means Kala Adi means Kala Artha Karmana. Yogo Hina Mithyati Matra. Swapramana ho gaya. If it is Swapramana, Anugrihya. That's Anugraha. Vruddhi Kshaya Yogat. Dushayanti. Which one? Vaikrita Vata Vitta Kapha. Prakriti is standard, it never change. Your Prakriti never change. If changes, that is Arishta Lakshana, cause of disease. Because circle is displaced. If Prakriti is deranged, means your circle is deranged, your death. So Vaikrita can change. Then when changes, that is a disease. Or Swabhavika, there will be change. Morning Kapha more, noon Pitta more, evening Vata more. Balya, Kapha more, that is Swabhavika change. By disease also, by Kalartha Karma Yoga Hinimata, by these causes also, there will be derangement of Vaikrita Vata Pitta Kapha. That causes the symptoms. If Vruddhi, Prakopa, Prasara, Sansamsha, Vyakta of the any disease can happen. I hope I am able to tell you. Next please, next. No, previous one. Here very important thing, previous one. From Madhura Vipaka, Kapha forms. From Amla Vipaka, Pitta from Katu Vipaka, Vata forms. Here one query is there. See, Madhura Vipaka is Prutya and Apya Mahabhuta. Sama Sarva Samani Vruddhi Karanam Hrasa Hetur Visheshascha. That is Samanya Vishesh Siddhanta. Samana Guna Karma Dravya. Which one? Madhura. To Kapha. That is why Kapha forms. And as you take the food, Kapha forms. If you take more Madhura Vipaka, Ahara Vihara, what happens? Kapha increases. Vruddhi, Prakopa, Prasara, Sansamshaya of the Kapha Javati. Then Katu Vipaka. Katu is made up of Amla Vipaka. Amla Vipaka is made up of Agni and Jala. Samana Guna Karma Dravya. You take continuously. Swapramana. Still take more. Vruddhi, Prakopa, Prasara, Sansamshaya. Which one? Pittaja, Vyadhis. Swapramana forms, it is health. Daily you are taking food. Shadrasopeta Ahara Vihara. When Katu Vipaka Ahara Vihara you take, Katu Vipaka is made up of Agni and Vayu. But Vata Dosha is made up of Vayu and Akasha. It is not Samana Guna Karma Dravya. How it is forms? How we can explain it? I hope that is a question. There is a question. Why? Because Vayu is a Amurta Dravya. Akasha is Nitya always. There is Nitya, Nitya Bheda is not there. But Prithvi Apateja Vayu, Nitya, Anitya Bheda is there. Where when you take in Katu Vipaka, Vayu and Agni is there. When you take more Katu Vipaka Ahara Vihara foods, Katu's Agni what does? Agnina, Rikte Srotasam. Srotas Rikta ho jaye. Shoshayitva. Agnina, Rikte, Shoshayitva, Rikte Srotasam. Shoshana occurs by Agni. Srotas becomes Rikta. Purayitva Nilobali. Vayu is filled by Katu Vipaka, but Akasha is there. When nothing is, that is Akasha. Akasha is present everywhere. That is why no need of Tikta Vipaka. Tikta is made of Vayu and Akasha. He does not tell Tikta Vipaka. He tells Katu Vipaka. That is why he tells that Agni needs to do Dhatu Shoshana. Then Purayitva Anila. Anila will be formed. Vayu and Akasha. Akasha will be there. When nothing is, that is Akasha. So there should be Rikta Srotas, then Vayu presents there. Vayu and Akasha forms Vata Dosha. Then it does all the functions in the body. So I hope you understood this concept. It's a very important thing. That is why Katu Vipaka is told. If you take more Katu Vipaka Ahara Viharas, Swapramana, there is health. If you take more Katu Vipaka Ahara Vihara, more Rikta Vata Prakopa, Dhatukshaya occurs, Vata Prakopa occurs, Prakopita Vata gets Sansamshaya, you get a disease. So that is why a Vata Prakriti fellow will have more Rikta Sotas. That is why he is Tattva Lagushita Karasur. He will always Kshina. A Kapha Prakriti fellow their Viktas also will be less, he will be heavy. I hope you understood. It's very simple concept, a mathematical concept. On that basis, whole Ayurveda is developed. Okay, can I move forward? That is why this dosha is important. That is why any physician, Charaka says, Trivida Bodha should be there. Trivida Bodha. What is Trivida Bodha? Trivida Bodha. Vikara Prakriti. Involved doshas in a given disease. Vikara Prakriti is different from Sharira Prakriti. Sharira Prakriti is one, whole body Prakriti. That is Prakrita Vata Pitta Kapha. Vikara Prakriti is stage of Vaikrita Vata Pitta Kapha. Vikara Prakriti. So unless you understand this Vata, involved dosha in a given Vyadhi, you can't give treatment. Vikara Prakriti. Then comes Adhisthana Vishesha, place of the disease, Adhisthana Vishesha. Third one is Samutthana Vishesha, how disease has formed, Samutthana Vishesha. One is Samutthana Vishesha, second one is Adhisthana Vishesha, third one is Vikara Prakriti. This Adhisthana Vishesha and Samutthana Vishesha, you can utilize all modern diagnostic techniques, all modern knowledge you can utilize. But for this one, you should utilize your Ayurveda knowledge only. By your X-ray, MRI scanning, all this, you can't find out Vikara Prakriti. But you can find out Adhisthana Vishesha and Samutthana Vishesha. These two things you can understand. You can utilize all modern diagnostic technologies, because if you utilize it, your diagnostic skill and fastness will be more. These two things, very fast you can diagnose. Without that also you can diagnose, without a modern diagnosis, but it will be slow. If you do this one, it will be very fast. In today's Vaidya, 21st century Vaidya, should utilize all the modern advanced diagnostic technologies. How much you utilize, how much you are able to understand and utilize it, that much fast you can diagnose the place of the disease and the Samutthana Vishesha. But then at the same time you have to see Vikara Prakriti. With skipping this, you can practice, but it does not become Ayurveda. With utilizing this one, it becomes. So, coming to Adhisthana Vishesha, about Madhumeha. Usually you think Madhuram Yacha Meheshu Prayohu Madhuyaha Mehati. Sarvepu Madhumehakyo Madhuryacha Taurata. Usually Madhumeha means you think that urine should be sweet. That is what told in Ayurveda. I don't think it is not only that much. What Ashtanga tells? Madhuryacha Tanorata. Whole body is sweet. When urine becomes sweet, if your blood sugar goes more than 180, before that there is no Madhumeha. It may be. Whole body becomes sweet. That is why he says, that in Shloka itself he says, Madhuryacha Tanorata. Whole body becomes sweet. Whole body means or your blood, the fluids of extracellular fluid, everything, including blood, everything is sweet. That is Madhuryacha Tanorata. Sweet will be there. One is urine is sweet. Second one is body also sweet. Madhurya Tanorata. Now coming to Hetu Vishesha, Bahudrava Shleshma Dosha Vishesha. For Prameha, Kapha is involvement, but Kaphas, when Jali Amsha increases, you get Prameha. Jali Amsha increases, you get Prameha. Then Sthana Samsha will be Bahubadda, Meda, Mamsa, Sharira, Kledha, Shukra, Shonita, Majja, Lasika. About 10 Dushya Vishesha will be there, places of the body. Samutthana Vishesha utilizes Bahudrava Shleshma. Sthana Vishesha will be all 10 Dushyas. So, pathogenesis of Prameha is Bahudrava. Kapha and Kapha involvement will be there. In the Kaphas, Jali Amsha more, you get Prameha. Next please. So, Prameha means it has 20 types. Kaphaja 10, Pitta 6, Vataja 4. Now, we are interested in thinking about Madhumeha. In that Vataja, not interested in these two, you are interested in the Vataja, there are 4. Next please. That is 4. Majjameha, Ojomeha, Madhumeha and Hastimeha. These 4 mehas are there. That Madhumeha, we are more interested now about diabetes mellitus. We are Madhumeha you are discussing. Usually call it as a Madhumeha. This Madhumeha, according to Ayurveda, how many types are there? How many types of Madhumeha is there? Usually tell Madhumeha means one. Right or not? Madhumeha is one type. I am asking how many Madhumeha is there again. You see, for Madhumeha, there is another pathogenesis is told. First told in Ashtanga Sangraha, then Madhava Nidana elaborated it. In Charaka is there, in Sutrasthana and Chikisasthana, different explanation he has told. In Ashtanga Sangraha, very clearly he made this differentiation. That is Vishesha, he has different. Hetu Sthana Vishesha Babed Roga Vishesha. Vishesha, specialization he has done here. See, Madhumeho Madhusamam Jayate Sakhila Dvidha. He tells two. What is that? Krudhe Dhatukshayat Vayoho Doshavrata Patho Athava. This is according to causative factors, there will be two types. One is Dhatukshayat Vata Prakopa getting a Madhumeha. But Vayu is a moving entity in our body. It can be blocked by all other stable entities like Rakta, Mamsa, Meda, Asti, Majja, Shukra, Vittu, Mutra, Anna. Anything cause blockage, avarana of Vayu, Prakopita Vayu gets samsaya, you get a disease. That is Krudde Dhatukshaya, Dosha Avrata Patho Athava. He tells by Dosha Avarana, Vata Prakopa occurs, gets samsaya, you get a disease. Which one? Madhumeha can occur. Why he has told Dosha Avarana? In Vata Vedyadya he says, what he says? Dhatukshayat Kopo Margasya Avaranena cha. He has not told Dosha Avarana. But in Madhumeha he tells Dosha Avarana. Why? Because there is a need, query is there, why it is. Because by Rakta, Mamsa, Meda, Asti, Majja, Shukra, all these things, Vata Prakopita Vyadhi will be Ekadeshaja. Whereas Kapha Pitta Avrata Vyadhi will be Sarvadayika. Because Vata Pitta Kapha are Sarvadehanusari. It is a molecular level, atomic level, Kapha Pitta Avarana Vyadhis. Whereas Rasarakta Mamsa Asti Majja Shukra is a tissue level, whereas Vitta Anna Mutra is a macro level. Three levels are there. Three level Avarana can happen. In a molecular level Avarana is Kapha Pitta Avarana. It will be Sarvadehanusari. So you can't have right hand Madhumeha, left hand no Madhumeha. It is possible. Is it possible? A Rakta Avarana Vata can happen one hand, one leg, like Pakshagata, all these things. But Madhumeha should happen all over body. That is, it is a Dosha Avrata Patho Athava, not Marga Avarana. Which are doshas? For Vayu, which are doshas? Kapha and Pitta. Kapha Pitta Avaranat, Vata Prakopaja, Madhumeha. Then used word Athava. Athava means what? Athava means Dhatukshaya due to Dosha Avarana. Dhatukshaya due to Dosha Avarana. Next please. So now it becomes how much types? It becomes 4 types. One is Dhatukshayat Vata Prakopa, one Kevala Vata. Second one is Kapha, only Kapha Avarana. Third one is only Pitta Avarana. Fourth one is both Kapha Pitta Avarana. So Madhumeha becomes 4 types. I hope you understood. Why it is needed? You are a clinician. If a patient comes to you with the blood sugar 300, he tells you, give me a drug. What you do? What you do? You give a drug. ಎಂತ ಮಾಡ್ತೀರಿ? ಶುಗರ್ ಹೆಚ್ಚುಂಟು, ಶುಗರ್ ಕಡಿಮೆ ಆಗಲಿಕ್ಕೆ ಒಂದು ಡ್ರಗ್ ಕೊಡಬೇಕು ಅಂತ. ಕೆಲವರು ಅಸನದಿಗಣ ಕೊಡ್ತಾರೆ, ಕೆಲವರು ಕಥಾ ಖದಿರಾದಿ ಕೊಡ್ತಾರೆ, ಕೆಲವರು ಕೋಜೆಂಟ್ DB ಕೊಡ್ತಾರೆ, ಕೆಲವರು ಡಯಾಬಿಕಾನ್ ಕೊಡ್ತಾರೆ, ಕೆಲವರು ಆರೋಗ್ಯವರ್ಧಿನಿ. Some persons gives classical drug, some persons patent drugs. What is your motto? To decrease the blood sugar, finished. I hope you understood. You never think Samuthana Vishesha. Is it by Dhatukshaya or Margavarana? If it is Margavarana, is it by Kapha, is it Pitta or both Kapha Pitta? Can you give same treatment for everybody? It's a logical question. Otherwise what you do? For everybody you give Asanadigana Kashaya. according to your fancy. Some persons is utilized only asanadikana, some person katha kadira, some person other drug. It is your fancy. I hope. Am I right? I hope. What you have to do actually, mathematically, you have to diagnose, is it kapha is it pitta or is it kapha? That is samuthana vishesha. In Trividha Bodha, samuthana. First you do which dosha, then samuthana vishesha. Which one? I hope you understood. It's very important, this Tridosha Siddhanta here comes. Because a Pittavarana Vataja Madhumeha is 300 blood sugar, a Pittavarana Pittavarata Vataja Madhumeha comes. Another patient comes with Kaphavarana. For him you have to give one drug, for him you have to give another drug. Can you give same treatment? Or another person may come Dhatukshaya Vatavriddhi. How you can give same drug? I am not talking about Prameha, I am talking about Madhumeha. So next please. Athava means, now Athava means what? Dhatukshaya due to Margavarana. Initially, next please, initially, patient comes with the Avarana symptoms. For example, initial diabetic patient comes with the heavy Svedadikyata, Kshudadikyata, Trishnadikyata, or heavy fat, everything may be there. If you don't treat him, what happens? Athava occurs. Slowly, Dhatukshaya occurs. He becomes lean and thin. So, he will be converted into Dhatukshaya, Vataprakopaja, Madhumeha. Initially, he comes in Avaranajanya. As the time passes on, he will be converted into Dhatukshaya. So, if a patient comes to you, diabetes 300, it may be 90% Avarana, 10% Dhatukshaya. 50% Avarana, 50% Dhatukshaya. Another patient may come in 10% Avarana, 90% Dhatukshaya. Can you give same treatment? That is avasthavashena chikitsam kuryat. In which avastha he comes? That is athava. I hope you understood. And if you are a clinician, it comes very important. When you are sitting in the clinic, it's very important. You can't give, ee vara ee maddu tagodi, next week banni nodu anta. Then he thinks this doctor is doing some experimentation, trial and error. You should, it's a mathematical concept. You should diagnose, this much percentage Avarana is there, you do Avarana Hara Chikitsa. Or this is Dhatukshaya Avastha, you give Brahmana Chikitsa. You can't do it actually, it's asadhya. Like that, you should analyze it in a given patient. I hope this concept is very important in all the patients. Next please, as the time passed on, Avarana comes down, Dhatukshaya takes over. My question is, how this Avarana comes down by itself without treatment? Even if you don't treat him, Avarana slowly comes down, Dhatukshaya takes over. How Avarana comes down? What is Jvara Chikitsa? Langanam, Kalo, Yavaksa. Kala is a Amapachaka. As by Kala, time, does Amapachana, Avarana comes down, Dhatukshaya, but it takes over. If as a physician, if you don't allow Kala to do Amapachana, you do yourself, then Dhatukshaya will not happen. Dhatukshaya will not happen. As a physician, if you do yourself just like Kala, Dhatukshaya will not happen. That is why he says, in modern medicine they say, I treat, God heals. What is God? God is Kala. Time is Kala. That is why Vaidya is called as Vaidyo Narayano Hari. You are Hari, just like God. You are doing Amapachana. Then Kala will not, Dhatukshaya will not take over. That is why always, as soon as patient comes, if he is in Avaranavastha, you do Amapachana Chikitsa. Pachana Chikitsa is Ayurveda treatment. Amapachana should be done. That is your treatment. Next please. So, with this one, Kulaja and Apatya Mitaja. Kulaja is, anyhow, it is asadhya. When it is Apatya Mitaja, Avaranajanya, you can treat. These things you can treat. He said, this Avaranajanya is Kashta Sadhya, Krichra Sadhya. Whereas, Dhatukshaya is asadhya according to Ayurveda. So, slowly it will be converted into Dhatukshaya. Next please. Previous one. You see, in modern science, this diabetes mellitus is done two types. One is insulin dependent and one is insulin resistant. In both the type there is insulin is there. What does this insulin? What is the work of insulin? Yeah. See, insulin molecules insulin molecules, as you take the food, glucose is formed, glucose molecules attaches with the insulin, that goes to cell membrane. In cell membrane, there are insulin receptors are there. The insulin attaches with the insulin receptor, then pores of the cell membrane opens, glucose enters inside. Glucose enters inside. In Krebs cycle, you get temperature, heat is produced, energy is produced. This is how metabolism happens, glucose metabolism. When insulin is there, molecules are produced in beta Langerhans of the pancreas, beta Langerhans cells. So if sufficient insulin is not produced in the body by some kulaja, this one, from DNA factor, anything, then insulin has to be given from outside. That is insulin dependent diabetes mellitus, it is called. For a smaller persons, babies, everything, it happens. Now in some persons what happens, plenty of insulin is there. Usually it occurs above 30-40 years aged persons. Plenty of insulin is there. Insulin, glucose molecules attaches with insulin molecules, goes to cell membrane, but cell membrane insulin receptors does not recognize the insulin molecules. It does not recognize. Then what happens? Insulin could not enter into the cell. Insulin is there. Then naturally blood sugar level increases. Hyperglycemia occurs. You call it as diabetes mellitus. Now what you do? You give insulin, if you give any number of insulin, it is not useful because insulin is there, plenty of insulin is there. But glucose does not enter into the cell. Then when cells does not get food, they start to weep. Uska mummy kaun hai? Mummy doodh de do. Usually glucose needed for metabolism of brain cells. They can't live more than 3 to 4 minutes without glucose. Immediately they will stimulate hypothalamus. Hypothalamus thinks that there is no plenty of insulin, that in turn stimulates beta Langerhans cells in the pancreas to produce more insulin. Insulin is produced, but insulin already there. This vicious cycle goes on. That is why insulin resistance is there. It is previously it is called as non-insulin dependent diabetes. Now it is called as insulin resistant diabetes. Insulin resistance for insulin is there. Insulin resistant diabetes mellitus. Producer. What happens? Beta Langerhans cells start to, if you do work more than your capacity, what happens? You will die out. Like that, beta Langerhans cells start to die out. It's a death occurs. Initially, plenty of insulin is there, but it does not work. Slowly, insulin production is more, beta Langerhans start to die out. Slowly, all cells death happens, that will be degenerated. Then even insulin is not produced, this will be converted into insulin dependent diabetes mellitus. Same thing as told in Ayurveda. They call it as resistant, we call it as avarana. It is physiological, not anatomical. Anatomy, you open the body, you can't see there is a block. It is a physiological block. Slowly cells die out. Avaranath, death means dhatukshaya happens. Avaranath, dhatukshaya occurs continuously. Then slowly it will convert it into dhatukshayaja, vata prakoja, madhumeha. Non-insulin dependent diabetes, insulin resistant diabetes will be converted into insulin dependent diabetes mellitus. This is what happens in the Western science. They are explanation like that. In Ayurveda, not anatomy, it's physiological, but resistance, in modern sense, we can say only resistance. We cannot pinpoint what is the cause for resistance. But in Ayurveda principle, we can understand avarana or resistance by what? Is it by pitta, is it by kapha, or both? In Western science, you can't say. Resistance finished. You can't say why. But in Ayurveda, you can pinpoint it. Is it kapha, is it pitta, or both? You can plan the treatment accordingly. I hope we understood. So, which is more scientific then? Ayurveda or allopathy? So, you have studied such a great science. Why you are making your natamastaka? Ayurveda mein kuch nahi hai. You have studied such a great science. Definitely you can diagnose this is the case. You can do like this. you know. So utilize this principle of Ayurveda. Then you can diagnose and practice it. That's what I am saying. So, next please. So, doshartha vatajan. Next please. So, coming to management of the disease. Say, Dhatuksheja is asadhya, but Avaranajanya there is a treatment, Ahara, Vyayama and Aushadhi. Next please. Trans. Apatarpana Chikitsa is told, Patyahara, Vyayama and Aushadhi. These whole things are explained in Grantha. I don't narrate all the slokas, just I show the slokas. Next please. Go on next, do next. Okay, next. All you have to do, Rukshana Chikitsa, all these things they say. Same thing. Next please. Next. No, previous one. Mamsala meduro bhuri shleshma vishamaknaya sneho itna purva rukshaya tatha. Next please. Shuddha, by that get Shuddha Deha, then you do semi rasayanas, everything is told in textbook. I don't narrate all the slokas here. Next please. Because you can read in textbook. You see, for Vyayama he told, Ayamo vivido anghanam Vyayama iti kirtitaha. For everything he has given nirukti in Grantha. Next please. Next. So Adhana, previous one. Even you don't have money, then also you can give a treatment. He told many, this one, go with the cows, wander around all the things. That is the walking treatment. Or have a kupa, digging the well. This is all treatment he has told. Next please. And Panchakarmas is told. Next please. Or Karshana Chikitsas. Next. So, then Pathyas. Patya and Apatya. This is very important. Food is very important. Here you see, Patya is Shashti, Shali Shashti, all these things. He said Purana Anna, not Navanna. Why it is told? Nava is? Yeah. Why I am saying? Guru Tara why? If you Guru why? You see, here one concept I will tell you. It's very important concept. All the Vaidyas should know. You see, in Shatkriya Kala, what Sushruta says, Vruddhi, Prakopa, Prasara, Sthan Samshaya. Where is Sthan Samshaya occurs? Yatra Khavaigunnyo Vyadhi Saturapajayate. I think Shloka everyone knows. My question is, Prakupita dosha comes from there. Already there should be Khavaigunya. Who has done it? आपका कुर्सी रेडी करना चाहिए. कुर्सी कौन रेडी किया है? Dosha prakopa occurs, he comes there. Before that, who should do? Without dosha, nothing is possible in the body. I hope you understood my question. Prakupita dosha comes there. Without dosha, nothing is possible. Before coming Prakupita dosha, who does? Dosha does all things. Dosha is coming there. Before that, who has done it? I hope. Which dosha? How that? Already prakopa comes there. Before that itself should be happen. I hope you understood my question. By ahara, vihara, all these things, nidanas, dosha prakopa, paridhava manata. He comes there. Already khavigana should happen. Is it a valid question or not? It is a valid question? Okay, valid question or not? So, how we can explain? Because in nidanas, there are two types of nidanas told. Dosha pratyanika nidana does vruddhi, prakopa of the doshas. Vyadhi pratyanika nidana does, which vyadhi occurs, that particular nidana directly causes dosha prakopa in that particular area, does the khavaigunya. By doshas only, that does the khavaigunya. When this khavaigunya occurs, then only the dosha comes and sit there, you get a disease. So, kursi ready karna chahiye. So, this vyadhi pratyanika nidana and this khavaigunya is specific for each disease. It is told in Granthas. For example, for Jvara, Pitta is khavaigunya dosha. Pitta is khavaigunya. Pitta's Agnayamsha is the specific. Agnayamsha causes the khavaigunya dosha. This khavaigunya dosha, coming dosha is Vata, then increased temperature will be Vishamavega. Jvara will be Vishamavega. If it is Pitta, that also Pitta is also Pitta, then Tivra Vega. If Kapha is coming there, this is Pitta, then Manda Vega will be there. Don't think by kapha there will be decreased temperature. There will be manda vega. When it is vata pitta, vishama vega but tivra jvara. In vata kaphaja, vishama vega but vata kaphaja. Vata kaphaja, manda vega. When kapha pitta, punaha mandam, punaha tivram. If kapha is there, manda, pitta is there, tivra. When a sannipataja, kshane mandam, kshane tivram. Svedana, all these things. That is asadhya. But according to which dosha you can diagnose, give specific treatment. For each vyadhi there will be specific khavigunya doshas are there. For atisara, khavigunya dosha pitta. Again, pitta jaliyamsha more. In rakta pitta pitta. In grahani vata. In kasa kapha. In shwasa vata dosha. In unmada vata. In apasmara kapha. In pakshagata, all these vata. In runashota, rakta pitta, kushta, all these pitta dosha is there. For each disease, khavigunya dosha is fixed. Like that, for prameha, khavigunya dosha is kapha, jaliyamsha of kapha. So when the jaliyamsha kapha more you get prameha, if you give navanna, it has prabhuta jaliyamsha. That jaliyamsha increases, madhumeha increases. If purananna, it becomes ruksha, jaliyamsha decreases, so that it will not cause increase of jaliyamsha. Khavigunya dosha will not be increased. That is why Purana Anna is advised in a Madhumehi, Pramehi persons. I hope you understood. So if you know this Karyakarana Vivechana, while practicing, you do specific treatment. That is why you should know this Karyakarana Vivechana concepts in every disease. So all these things are told, it should be all Purana, not Nava. Everything should be Purana. Next please. Apatya, Savira, Tushodaka, Meya, Sura, Savira, Paya, Grita, Taila, all these things should be avoided. Next please. Then comes Aushadhi treatment, Shodhan and Shamanam. Specifically, Vamana Virechana is told in the Madhumeha or in any Prameha. If it is Kapha Avarana, do Vamana. If it is Pitta Avarana, you do Virechana. Both Kapha Pitta, do both Vamana and Virechana. And Rukshana Chikitsa should be done. And Shamana Chikitsa is always Katutikta Kashaya Rasa Dravyas. It is useful for only in Avarajanya. If it is Dhatukshaya Vata Prakopa, if you give this one, still Dhatukshaya occurs. That is why it is Asadhya. Dhatukshaya Vata, if you give Madhura Ahara Vihara, Jaliyamsha Kavaigunya dosha increases. If it is do Karshana, Vata dosha increases. So that is why it becomes Asadhya. Whereas Kapha Pitta Avarana Janya, you can do Karshana Chikitsa until that Kapha Pitta Karshana occurs, Amapachana occurs. After that, if you do still more Shodhana, what happens? By treatment itself, that Dhatukshaya occurs. That is why you should be very careful when you are treating. Avastha Vashena Chikitsam Kuriyat. That is why Granthas are told, Avaranajanya Vyadhi will be Parisamvatsarotita. After 1 year, it becomes Yapya. Before 1 year, it is Krichra Sadhya is told. Not Asadhya, Krichra Sadhya. Next, please. There are many drugs. Asanadi, Varunadi, Patoladi, all these things. According to your presentation, if it is more Kaphavarana, do more Kaphahara Chikitsa, more Pittavarana, more Pittahara Chikitsa. I am telling the concept. I am not telling you give this drug, this is for very good for diabetes. Give this drug, this is very good for that. Like that, I don't want to tell you. As it is hypothetical. As person comes, you diagnose, you decide which drug should be given according to your condition. I can't say you give this drug, Asanadi Gana, very good, you take 1 quintal of Asanadi Gana, you become all right. I can't say. Because today it may decrease, after one year it may not be useful. Because your condition may change. That is why it's very important. Next please. Then Vyayama Chikitsa. Vividha Anganam Ayam Karoti iti Vyayama. In Vyayama, there are many types are there. Cardiovascular exercise is there. Muscle strengthening exercise is there. Right? If it is a patient of Pitta Avrata Janya Madhumeha, how you will know it is Pitta Avrana? There will be Trishna Adikyata, Kshudadikyata, Svedadikyata, all Daha Santrapa, Trishna, Murcha, Brahma, all these symptoms will be there. some symptom may not be there. You can diagnose. If it is kapha varna, gaurva shaitya shothani. Heaviness, all these things will be there. In both kapha, he may be heavy at the same time, trishnadikyata, all these things will be there. These are the possibilities. You should do permanent combination, should diagnose and give the treatment. Cardiovascular exercise, what you do? Jogging, running, walking, all these things. Some patient comes and tell me, Doctor, ನಾನು ದಿನ 10 ಕಿಲೋಮೀಟರ್ ನಡೀತೇನೆ, ಆದರೆ ನನ್ನ ಶುಗರ್ ಕಡಿಮೆ ಆಗಲಿಲ್ಲ ನಾನು. If it is a pitta avrtajanya madhumeha, if you tell him cardiovascular exercise, it is useless. Already his pitta is more, metabolic activity is more. No need of doing him cardiovascular exercise. For him, you have to teach him muscle strengthening exercises. Ghana shitila mamsa will be there. If a patient of pitta varna, there will be mrudu and shitila mamsa. If you touch his, it will be soft. Mrudu mamsa. Ghana shitila mamsa. Teach him muscle strengthening exercise, dumbbells, all these things. No need of increasing heart rate. Walking, running is not needed, not at all useful. For him, you teach him dumbbells, doing Surya Namaskara slowly. One Surya in 2 minutes like that, slowly should do. If it is kapha varna, ghana mamsa is there, reduce his fatty thing, gauravatva should be reduced. Teach him cardiovascular exercise, walking, running, jogging, or fast Surya Namaskara, all these things you can teach him. His heart rate should increase, metabolic activity should increase fast. For him, for whom? Kapha avartajanya madhumeha. For pitta avartajanya, teach him muscle strengthening exercise. Ghana shitila mamsa. When dhatu kshaya vata vruddhi is there, for such patients you teach him muscle relaxing exercises like yogasanas, yoga nidra, shavasana. These things are very useful for dhatu kshaya vata vruddhi. For them you teach him. His activity will decrease. Even the mental activity also. More rajasika person is there, vata prakopa is there. More tamasika, there will be kapha prakopa will be there. Or in more tension, all these things, pitta also will be increased, krodha, all these things. For such a patient to teach him yogasana, all these things. You can reduce his activity, psychological activity. That also causes the disease. This yogasanas will help you. Next please. Coming to pranayamas, there are different pranayamas there. Kapalabhati is there, Bastrika is there, Nadi Shuddhi is there, Sitri is there. If a patient has kapha avrta vatajanya madhumeha, teach him Bastrika or Kapalabhati. If a person of pitta varna, if you teach Bastrika, Kapalabhati, it is not useful. Not useful. For him, you teach him Sitali pranayama, Sitkari. Make him cool. For kapha varna, teach him Bastrika, Kapalabhati. That is why he says in shloka itself, Bastravallahu Pujanamsro, Kapalabhati Kyato, Kapha dosha vishoshini. Kapha dosha vishoshini. He very clearly has told. Swatmarama has very clearly told. Next please. When Sitkari is there, Gulma Pliha Jeka Rogan, Jaram, Pittam, Kshudham, Trusham, Kshuddha and Trisha, Vishani, Sitali Nama, Kumbikeyam, Nihantihi, Pitta, Kshuddhadikyata, Svedadikyata, Trishadikyata will be there in Pitta Varna. Such condition, teach him Sitali Pranayama. If you know mathematical equations, easily you can practice. Nadi Shodhana Pranayama, Yatodharma Vayo Analasya Pinasam, Nadabhyamhanteyam Jayate Nadi Shodhanam, Vayo Analasya Pradipanam. Vayu and Agni Pradipan ho jata. When there is a Dhatuksha Vataruddhi is there, in these conditions you teach him Nadi Shodhana Pranayam. Usually, a Avarnajanya Madhumeha, Avarna will be there, at the same time there will be slight Dhatuksha will be there. Either you teach him Kapalabhati and Nadi Shodha, or Sitali or Nadi Shodha. If some person, Kapha Pitta Avarna both is there, teach him Kapalabhati, Sitali and Nadi Shuddhi Pranayama. Continuously if teach him, slowly his sugar comes down. It's a very important thing. And at the same time, mental status also cooling down happens. Psychological factor also. Next please. Prameha nivrutti lakshana. Mutra pichchilam anilam vishadam tikta sadarogyam jayate. So you can achieve. A recently originated Madhumeha, if patients are there, you can make him non-diabetic. Definitely you can make him. if a patient follows your instructions. If a patient does not follow, because it's all our Ayurveda treatment is patient-centric. You can't dictate. It is not Prabhavi. In modern medicine, even if you do all apatyas, for sometimes they give hyperglycemic may control, but long time it will not happen. But in Ayurveda, you can't do like that. If he takes sweet at the same time, you give kashayas or this pranayama, this is not useful. So it's very important. Patient should follow your instructions. Next, please. So slowly Avratanya converted into Dhatukshaja. You can treat all these conditions up to here. Then it becomes difficult in this stage. But you can treat the cases. Next, please. Next, then coming to Rana, diabetic wound. I have shown you wound, how it should be treated. I will tell the concept of gangrene foot. That is Rana. So, Ranas, Dova, Sharira, Agantusha. Textual, this one I will not tell. I will just show some slokas, that's all. Next, please. There is Doshopla Vishesha. There are totally Shodasha Prakara Rana, Sushruta has told. Next, please. According to Prasara. Next, please. In total, any Vyadi and also in Rana, 3 doshas are involved. How you will understand involving of Vata Pitta Kapha? If there is a Shula is there, that means Vata is involved. If Daha, Paka, Kotha, this there, Pitta is involved. If Shota, Shaitya, Gurutva, that means there is Kapha is involved. That is what is told in Sloka. Next, please. All these 3. If Avaranajanya Vata is there, will be Shula. If Dhatukshaya Vata is there, will be Shosha will be there. Pitta, next, please. So, in any disease, especially in Rana or any other disease also, always you should understand, one is Sthana Samshaya. In Rana, it presents all over body, anywhere it can happen. But Samuthana Vishesha, how Dosha Prakopa has happened, how Runashota occurs. Actually, this concept basically told in Charaka, even though he is a physician. Why I am telling, in the Runashota, all 3 doshas are involved. In the Amavastha, Vata Pradhana, in Patyamanovastha, Pitta Pradhana, in Pakkovastha, Kapha Pradhana, Kapha is involved. Initially, Vata Prakopa should happen to get a Runashota. So, without understanding how this Vata Prakopa occurs, you can't understand the Runashota at all. That is why in Sushruta Samhita, Nidhanasthana, first chapter is Vata Vyadhi Chikitsa, Vata Vyadhi Nidhana. So, understanding how Vata Prakopa occurs, you can't understand Runashota how it occurs. So, here always Samuthana Vishesha, a Samprapti means Yatha Dushtena Doshena, Yatha Cha Anuvisarpata, Nivrutti, Yatra Sansamshya. These 3 things you should understand in every case, every patient. Yatha Dushtena Doshena, here Prakopa is Vata Prakopa occurs. How Vata Prakopa occurs? Next, please. What he says in Charaka, Vayoho Dhatukshayat Margasya Avaranena Cha. Here 3 factors, not 2. One is Dhatukshayat Vata Prakopa, second one Margavarana. Cha means Dhatukshaya due to Margavaranam. Next, please. Initially, by Ruksha Shita Viruddha Ahara Viharas, Dhatukshaya occurs, Vata Prakopa gets Sansamshaya, we get a vector of the disease. For any disease, Vataja. Next, please. In Avarana, Vayu is moving entity. All other entity can block movement of Vayu. It is not anatomic, it is physiological. Kapha, Pitta, Rakta, Mamsa, Meda, Asti, Majja, Shukra, Vitt, Annamutra. Here, Kapha, Pitta, Avarana will be in molecular level, as I have already told. Rakta, Mamsa, Meda, Asti, Majja, Shukra in tissue level. Vitt, Annamutra in macro level. Avaranat, Vata Prakopa gets Sthana Samshaya, vector of the disease. A Kapha Pitta Avrata Vyadhi will be Sarvadaika, just like Madhumeha, it's already I have told. Rakta Mamsa Meda Asti Madhya Shukra, in that particular tissues where it occurs. Since Rakta presents everywhere, a Rakta Avarana Vata Prakupita Vyadhi will be everywhere, but all over body, anywhere it can happen. Not all over Sarvadahika. It is Ekadeshaja, but anywhere in the body. Whereas Kapha Pitta Avrata, Sarvadahika, everywhere. One is everywhere and one is anywhere. I hope you understood that is the difference. Next, please. So, like this Prakupita gets Sansamshaya, that is Gata Vata. Amashaya, Pakva, Sandhigata, Koshtagata, Twaggata, Raktagata, anywhere. It can happen anywhere in the body. Next, please. Initially, Avarana symptoms are more, Dhatukshaya symptoms are less. As time passed on, next please. Cha, Dhatukshayat, Vata Prakopa, Prakupita Vata, Gesta Samshaya. If you, for example, Agrudrasi or Pakshagata, these things comes initially, only Avarana symptoms are there, only loss of movement or pain, everything will be there. As time passed on, what happens? All body becomes, that part will be degenerated, Dhatukshaya occurs. Initially, Avarana, Shula, all these will be there. As time passed on, Dhatukshaya, Shosha symptom will be there. How it occur? Because of that Avarana it occurred. That is Cha. I hope you understood. So this, if a patient comes to you, is he in Avarana Avastha or Dhatukshaya Avastha? If he is in Avarana Avastha, you give Karshana Chikitsa. If he is in Dhatukshaya Avastha, you give him Brahmana Chikitsa. That is why it is very important for a physician when you are sitting in the clinic to diagnose Avastha. That is a Cha. Next please. To understand this one, this concept, there is a simile. What is simile? River itself is a simile. In the river, what happens? Initially, sometimes whole river becomes dry from Moola Srotas itself in summer. Whole river becomes dry. Water-filled area is filled with what? Filled with the air. Dhatukshayat Vata Prakopa. Prakupita gets Sansamshaya, get a disease. If you river is flowing, you put a dam. Here Linganamaki dam. Kapha, Pitta, Rakta, Mamsa, Asti, Majja, Shukra, Vita, Annamutra dam. Then what happens? Water level increases. Water level increases means moving force increases. Avaranat, Vata Prakopa, Vimargamana occurs, you get a disease. What happens below stream, below that dam? That becomes dry. Avaranat, Dhatukshaya. I hope you understood. So initially, full Dhatukshaya, that is Dhatukshaya Vata Prakopa. Second one is Avaranat Vata Prakopa. Third one is Avaranat Dhatukshaya. In a Kapha Pitta Avarana Vyadhi will be Sarodahika Dhatukshaya can happen. In Rakta Mamsa Medha Asti Vajja Shukra, in Eka Deshaja it can happen. Or whole Dhatukshaya, whole body becomes lean and thin. Like Dhatukshaya Vata Pradumeha. He will become Tatra Ruksha Lagushita, he will be lean and thin, all these things will be there from initial itself. Some persons heavy, after some time he may become lean and thin. Avaranat Dhatukshaya. So because of that dam. These things, when you treat in Avarana, you remove that dam, he becomes all right. If you don't treat him immediately, slowly, whole becomes dry. So how much Karshana, how much Brahmana should be given, a physician should decide. That is your prerogative. Who's physicians? Now, this is a mathematical equation. You are in a clinic, how you will diagnose, is it Pitta Avarana, Kapha Avarana, all this. That is why in Charaka he gives this symptomatology. If Pitta Avarana is there, Lingam Pitta Avrate, Daha Trishna Shulam Brahmastamaha, Katpadivasho Vidaha, Shita Kamita. Shula is Vata symptom, other Pitta symptoms will be there. When Pitta Avarana, Vata Prakopaja, Vyadhi is there. When Kapha Avarana, Shula is Vata symptom, other Kapha symptoms are there. Shaitya, Gaurava, Kattvadipashadikam, all Kapha symptoms will be there. These two things are. Then coming to Raktavarana, what he says, why I am saying it is Ekadeshaja, just you see this symptomatology what he said. Daha, Arti Tvakmam Santarajo Brisham, in between Tvakka and Mamsa, Arti will be there. Raga, redness, Shvayatu Jayante Mandalani Cha, Mandalani Shvayatu. Can you think Mandalani Shvayatu occurs all over body? Mandalani Shvayatu is Ekadeshaja. Anywhere it can happen. That is I told, it is anywhere. Mandalani Shvayatu. In Mamsa Avarana he says, Katina Pidakaha, all these things. Anywhere it can happen. Like that for different Vyadhis he told in that particular Srotas. Here, the question is, Raga Shanya Mandalancha. Raktavate Daha. Arti means Shula, in between Tvak and Mamsa. It becomes very problem now. So I am a physician. Do you think any person comes to you tell, my pain is in between my skin and Mamsa? So what is its meaning then? How you will understand? I hope you understood. You go to Sushruta. What he says? Next please. Todaha sparshadvesha. Instead of that he used word sparshadvesha. Sparshadvesha means you touch him, there will be pain, tenderness. This occurs due to Raktavarana Vata Prakopa. If you see whole Samhitas, all the Samhitas, this sign occurs only due to Raktavarana Vata Prakopa, not in any other conditions. In Pittavarana there will be Sparsha Asahatva is there. That is hypersensitization, not Sparsha Dvesha. In Raktavarana only it occurs Sparsha Dvesha. So now it becomes very easy. When I am sitting in a clinic, if a patient comes, tell me I am having pain, burning, all these things. Then you touch him, he feels pain. That means he is having Raktavarana Vata Prakopa. Immediately you can treat him Rakta Prasada, Raktama Prachana or Rakta Mokshana Chikitsa you do. Finished. I hope you understood. Just you have to see why Rakta Dushti happened, that you have to analyze afterwards. So what is the cause? Immediately you can diagnose it. Next please. Now, so Daha, Arti, Raga, Sparsha, Dvesha and Shayatu, Mandalani, Shot. Now here one question arises. What is that? How you will understand a Raktavarana Vata Prakopa? Because in our body, Vayu and Rakta both are moving. Next please. Vayu and Rakta is moving. This phenomena explained in Vata Rakta Dhyaya. Vayu is Sukshma and Chala. Rakta also moving. It is Sara and Drava. Sara and Drava. So one moving entity blocks another moving entity. If you compare Rakta and Vayu, Vayu is Sukshma than Rakta. Rakta is Sthula than Vayu. So Rakta should block the Vayu. How we can understand this one? You can understand by a simile of a traffic. Anywhere Rakta Srotas is damaged or Rakta is damaged, that blocks the movement of Vayu. Vayu can't block the Vayu. Rakta can block the Vayu because Sthula. Just like in a traffic, all vehicles are going. Lorry, bus, heavy vehicles, small vehicles, bike, scooters, everything is going on. If anywhere one road is damaged, or one lorry is damaged, or bus is damaged, when you come with the next bike and scooter, you negotiate and go. But when next bus and lorry comes, it can't go. Can it go? It cannot. Then there will be accumulation of vehicles. Then if your next bike, lorry comes, bike, scooter comes, it also cannot go. Right? So first bike, scooter, lorry, etc. stops, then that itself blocks the movement of small vehicles. Just like that, first Rakta stops, then the Dushita Rakta itself blocks the movement of Vayu. Then what happens? There will be accumulation of vehicles. Mandalani Shayatu. Mandalani Shayatu. Heated exchange between drivers. Daha. Redness in the eyes of drivers. Raga. Loss of function. Pain. Sparsha Dvesha. Everything occurs. That is Raktavarana Vata Prakopa phenomenon. You get Mandalani Shayatu. It can happen anywhere in the body. Right or not? Anywhere in the body. So if you immediately remove that damaged vehicles, all these things, it becomes all right. You don't remove, what happens? Information goes to city center. Right? In our body, city center is hypothalamus. In turn, in that area, blood supply increases, all policemen, everything will come. They start, whole body temperature increases. Santapa occurs, jwara occurs by that. Raktavarana Vata Prakopa. By Runashota. This is nothing but, these 5 sign symptoms, nothing but sign symptoms of inflammation according to modern system of medicine. According to Ayurveda, it is Runashotha. It can occur anywhere in the body. Tvakmamsa sirasnayu sandhi asti marma koshta. Is there any place? Bach gaya kya? Whole body finished. Everywhere, anywhere, it can happen. So that Ekadeshaja Vyadhi may convert into Sarvadahika Jwara, all these things afterwards. But initially, it will occur like that. How pathogenesis occurs. Next please. To happen this, there should be Rakta Dushti. That's Samuthana Vishesha I am analyzing now. How to happen this Rakta Avarana, what is precondition? There should be Rakta Dushti. So in Vidishoniti Adhyaya, you see Rakta Dushti Karanas are told. Bahutikshno, Madhya, Tilavana, Kshara, like. Here, one question again arises. Rakta is a dhatu. Vayu is a dosha, Shakti Swarupi Dravya. How Rakta can block Vayu by itself? Can Rakta can block Vayu? Vayu is Shakti Swarupi. It cannot be blocked by anything. Right? How Rakta can block? How any other things can block? Or Mamsa, Meda, Asthima, how it can block? Because Vayu is Shakti Swarupi, no? Right or not? It cannot block. To happen this, first there should be a Shuddha Rakta cannot block. Anything Shuddha Dhatus can. But there should be Rakta Dushti should occur by doshas only. These dosha dushit Rakta can block movement of Vayu. Because Shakti comes by that doshas. That is why in the Rakta Dushti Karanas, first line you see, Pitta Swarupa Rakta Dushti Karana. Second and third is Kapha Swarupa Rakta Dushti Karana. Third and fourth is Vata Swarupa Rakta Dushti Karana. A Pitta Swarupi Rakta Dushti Karana causes Rakta Dushti, Rakta Arana Vata Prakopa, leads a Vyadi, any Runashota, any other Vyadi will have Pitta Vata Lakshanas. A Kapha Swarupi Rakta Dushti, Rakta Arana Vata will have Kapha Vata Lakshana. If Vata Swarupi Rakta Dushti, Rakta Arana Vata will have Kevala Vata Lakshana. It may be in Ranashota, Pakshagata or anything. I hope you understood. Or Dvidosha Karana, Dvidosha or Sannipatha. It can happen. So, while you treat Rakta Aranavata means you should see which dosha is involved. Like that, their symptoms will be there. It may be Ekadeshaja means Rakta Aranavata Prakopa, but you have to see which dosha Swarupa Rakta Dushti by analyzing signs and symptoms in that particular Vyadi, in particular patient. Not in textbook, in patient. I hope you understand. In a patient you have to see. So, and last another cause is Abhigata. Abhigata is injury. By Abhigatas, Rakta Dushti, Rakta Aranavata. One is Ahara Vihara, second one is Abhigata. What is third cause? Next please. By this many Raktaja Vyadis and Rakta Anubandhaja Vyadis are told. Many Grudhasi, Vishwachi, all this, many are told in Sushruta. About 167 conditions he has told. All these things can occur by Raktaja and Rakta Anubandhaja Vyadhi. Other cause for this one, having these diseases, one is Abhigata, second one is Ahara Vihara. Is there any other cause? Next please. Other cause is Raktadishtanajan Prayo Vikaran Janentite. That is Raktaja Krimis. Infections. Sukshmaha, Anamaha. You are saying in Ayurveda there is no explanation of infection in Ayurveda. Who has told? I have not told. Sushruta has told. Where it is told? In 56th chapter of Sushruta Samhita. Parasites, virus, bacteria, fungus, anything, any smokshma anus causes Rakta Dushti, Rakta Aranavata leading to Runashota and other diseases. Jara, all these things can occur. Pakshagata, by tubercular nodule, there will be Pakshagata. It is told, you know. Told. See, Rakta Prayan, Vikaran, Janayanti The. Vidradi, Gulma, all these, many diseases are told. Next, please. Go for next. Here, this infection theory, definitely it will be confusing for many of them. Usually, everyone thinks that there is no infection theory in Ayurveda. But it is very clearly told in Ayurveda, infection can cause the disease. If infection, krimi is the cause of the disease, why Sushruta has not told in first chapter of textbook? Told in 56th chapter. In Charaka he told in Vimanasthana. Why not in the first chapter? Then what is the cause of the disease? Just to analyze it. What is the cause of disease? Dosha Vaishamya or krimi? But he has told krimi. Its query answer is, you should analyze it. That's why I am saying. You see, I am having crores of bacteria on my body. I don't get any disease. Why? If cause of the disease is krimi, I should have disease. Why? Why I don't get any disease? No. I am in, why I don't get any disease? Because I am in samadoshavastha. I am in samadoshavastha. If by any means, abhigata and ahara vihara, if dosha vaishamya occurs, then krimi invades. Once krimi is invaded, it produces ama. How much amount of ama pachana chikitsa you give? How much amount of ama pachana you give? Ama continues, but unless you remove that krimi, he cannot be cured. That is why the treatment is told is apakarshana chikitsa, nidana parivarjana, and prakriti vighata chikitsa. Apakarshana means what? How you will extract? Can you extract bacteria one by one? Panchakarmas should be done. Panchakarma should be done. That is Chaturvidha Samshuddhi is told. In Chakravani very clearly told. That is Apakarshana Chikitsa. Nidana Parivarjana. Third one is Prakriti Vighata. Prakriti Vighata means no, not environment. I have a Prakriti myself. If my Prakriti Vighatan occurs, that is the death of myself. Like the Krimi also Prakriti. Krimi has a circle and triangles. How much Krimi is, that much triangles are there. If you do Vigatana of that Prakriti, that's a death of the Krimi. So killing of the Krimi is the Prakriti Vighata Chikitsa. Before advancement of microscope, this is done by Anumana Pramana. After advancement of microscope, you are finding which Krimi is there. Then in Western science, they have developed many drugs which can kill the Krimi without harming the host. Like antibiotics, all these things are developed. In Ayurveda, is there any drugs? Can you kill the Krimi? There are many drugs are told in Sushruta. Aragvadadi Gana, Surasadi Gana, Trivrutadi Gana, Arka Adigana, many drugs are there. Gomutra, Ksharodaka. I think Ksharodaka you are taking daily, using. You are using or not? Daily you are not using Ksharodaka. You are using soap, that is nothing but Ksharodaka. Daily we are using soap, it is nothing but Ksharodaka. I hope you understood. You are doing Krimi Prakriti Vighata. By utilizing soap, toothpaste, all these things are doing Ksharodakas. I hope you understood. The concept you understood. I am discussing only about concept. You can use any drug according to your convenience. If any disease comes with this Krimi in a septicemia stage, if you can't kill the Krimi, if you can't do Amapachana, Chikitsa cannot be cured, then he tells to do Amastambana and do Krimi Prakriti Vighata Chikitsa should be done. In Western science, they have developed a drug. Immediately you can refer the case to who can do it instead of harming the patient in that state. If you do with your drug, you can kill the Krimi at the same time. Amapachana can be done, you can do according to your concept. But that is the stage of the disease, state of the disease, place of the disease. According to your convenience, you should do. Previous. Go for previous one. Yeah. So, many of them usually ask me about this Avarana concept. Raktavarana, Mamsavarana is there. Why there is no Rasavarana? Actually, Rasa and Rakta together just like father and mother. When in Rasa Dosha, next please, Rasava Srotas, he says Srotaram Roja Klaibhya, Krishangata, all these things. Next please. What he says, Avrta Marga, there all the Marga Avarana occurs by Kapha, Pitta only does the Marga Avarana occurs. Avrta Marga, by Medasa Marga Avarana, Tvat Shesha Datava Napyayante, Atyartham Alpe Prano Bhavati. By Marga Avarana, there will be Alpa Prana occurs, so that you will have Prameha Vidaka, Jara, Bagandhara, Vidradi, Vata Vikaranam, Anyatamam, Pravinjate. All these things can occur by Marga Avarana in Rasava Srotas. This Marga Avarana occurs by, next please, Kapha Pitta. Next please. Next. You see, Kapha Pitta Avartas Maruto, Rasa Murchitaha. In Rasava Srotas Murchana by Kapha Pitta Avarana, Prakupita Matarishva gets Sansamsha at Rasava Srotas, you get Sroto Rodha. Like this, the concept, you will have Prameha Pidaka. Alpa Prana occurs, you get Prameha Pidaka, Vidradi, Vatavyadi. A stroke can happen, a MI can happen. Then you see he tells about MI, this one. Even in Burgess disease also. In all these things there will be Rasavasrotas, arterial block will occur. That is a Rasavasrotas. Block can occur, you get a diseases. Alpa Prana occurs because of reduced oxygen and food supply will be there. That is what he said. Next please. So as it is now clear that by this decreased Alpa Prana, there will be Raktadushti, Raktavarna Prakopa, Runashota can occur in that area, which can occur anywhere in the body. Tvakmam, Sirasna, Sandhyasti, Marma, Koshta, Raktadushti occurs. You get, if it is by Abhigata, your treatment should be Shalya Chikitsa. If it is by Dosha Dushti, Dosha Apachan Chikitsa. If it is Krimi Chikitsa should be done. Next please. So, Raktadushti Janya Vikar, Abhigata, Raktaja Krimi, other Vihara, Raktadushti, Raktavarna leading to Runashota, Amavasta, Pachyavan, Pakkavasta, you get a Runa. Next please. Next. This I have told you now, all the treatment of Krimi. Next please. Then he says, Rakshet balanchapi nityam tad rakshitam vyadi balam nihanti. In all these conditions, one is Prakriti Vigata and one is Bala, Rakshana of the Bala. Rakshet narasya nityam. If you do Rakshana of Bala of the patient, that Rakshita Bala itself nihanti Vyadhi Bala. Vyadhi Bala occurs. This is what Sushruta has told. Next please. Next. Let's say Apatarpana, many Chikisa. Apatarpana Chikisa is told. Next please. Next. 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 Sa Sambrambheshu, previous one. Sa Sambrambheshu Kartavyam Urdvascha Adashodhanam. Sa Sambrambha means when acute inflammatory swelling is there, a Runashota swelling is there, then Kartavyam Urdvam Adascha Shodham Upavasahitam Prak Rakta Mokshanam. Next please. I have shown you the video photos of Runashota, Runas, let us say Sa Sambrambha. Next please. Such patient you have to do, you see, Sa Sambrambhetu, you have to do what you have to do? Urdva Adashodhara. That is Vamana and Virechana. How it should be done? Usually we think that a Vamana you should do Snehapana, Sweda, then you do Vamana. Can you expect in such patient giving Snehapana for 3 days, 5 days, all these things? What he says? In such a condition, where is already dosha uklesha is there, you can do Sadhyo Vamana and Sadhyo Virechana. That can be done. Next please. You say, I did Vamana and Virechana, then it reduced, you see. It's all reduced, you see. Creases has come immediately, within 2 days. Next please. Next. Next. You go on doing next now. All the photos and videos are there. Next please. Next. Continuous you do. According to date, there is progress of the condition is there. Next. Aragvadadi Kashaya Askriti, Gomutra Arka, Aragvadadi Kashaya and Gomutra Arka, bit and lotion for the Runa Prakshalana, continuous done till complete cure. Modern antibiotics I have used for about first initial, when the patient came with the septicemic stage. He had about 21,000 total count, that is septicemic stage initially. Then I withdrawn all the antibiotics afterwards. Next please. After culture sensitivity we did it. It's become healthy. Then Ragrasayana, Kaishora Gugulu, Madhumeha, Apatarpana and Vamana Virechana and other drugs are given. Asanadigana, Chandraprabha, Vasanta Kusumakar Rasa initially. Initially patient had insulin slowly, then it was withdrawn. Patient came with the insulin. Ranadhupana done, fumigation. Next please, to Asyakrimigna. 2 continuous go for. So all conditions I am showing you. Patient came with the non-healing ulcer in the big toe. Next please. No case of diabetes for 13 years. Next please. Underwent surgery for diabetic ulcer in the other foot. Next please. Then he came for left foot. Came with the insulin and diabicide. Next please. Next. So total count was 12,300 when he came to us. Next please. Next, culture sensitivity done. This is Samprapti Vivarana. We gave these drugs and initially did Sadyomana first day. Next day we did Sadyo Virechana with the Gandharvastadi Erandam with the Gomutra. Sadyomana did with Yashtimadu Phanta. Next please. These are the drugs. Shamana Aushadhi is given. Next. Culture sensitive done and accordingly antibiotic needed. Then Tamra Basma for Runa Shodhana. As a criminal for Krighata and Runa Shodhana occurs with the Tamra Basma for dressing purpose. With the Jatya Tela is added. Next please. Next. Agni Tunya added. Next please. Next. So these are the drugs are given. Next please. Next. So it came like this with the acute swelling, all these things. As 6-3, next please, next. Amana Virechana done. Next. Slowly it's reduced. Started healing. Described about Rana Upakramas with the Dupana, Parishachana, Avasechana, all these things are done. In a diabetic foot ulcer, Sushruta has contraindicated Jalavaka Avacharana. He has told you can do Rakta Mokshana by Siravedana, not by Jalavaka Avacharana. Why it is told? In the Madhumeha Pidaka, he has contraindicated Jalavaka. But in Siravedana, Shringa Alabu, Jalavaka, Shringa Alabu and Siraveda you can do. But he has contraindicated Jalavaka. Why? No, in Runa it occurs only here. No? Many of them are using Jalavaka, that's why I am asking. He has contraindicated why? Because Jalavaka is Jala Adivasa. Madhumeha occurs, Khavvaigunya dosha is Jali Amsha increased, you get a Prameha. In such cases, if you do Jala Adivasa Jalavaka, the Kleda will increase instead of decreasing. That is why he told to not to do with the Jalavaka, but you can do Siravedha instead of that. That is why very clearly has told. And another thing, Prameha Pidaka occurs usually in the lower limbs because Gurutva is increased of Kapha dosha. That is why he tells it usually occurs in lower limbs, not in the upper body. You will not get any rudas. This is what he told in the Sushruta Samhita. Because Jala Mahabhuta is increased, Kleda is increased. That is why. Next please. So follow up. It's almost healed now. We could save his limb. This is what happened. Next please. Next. In the Sira Granthi, Sushruta told to do Siraveda, not Jalavaka. Why? There are 5 types of Rakta Mokshana is told in Sushruta. Shringa, Alabu, Jalavaka, Prachanna and Siraveda. For Vata Dushita Rakta, Shringa, Pitta Dushita, Jalavaka, Kapha Dushita, Alabu. Prachanna is 2 angula area of Rakta will move, Sira, Sarvanga Shodhini. This is one way of indication. Another way he tells, if it is Ekadeshaja, in Shringa, about a Dasha Angula area Rakta can be removed. In Alabu, Dwadasha Angula, Jalavaka, Hastamatra area. About Hastamatra. If you see the Sira Granthi, it occurs from whole leg. It is more than Hastamatra. In Jalavaka, how it can be done? That is why he says, instead of Jalavaka Basti Karma, he told Siraveda and Basti Karma he has told. That is why in such condition you should use Siravedana as a first line of treatment. Siraveda, Sadhyamahadevirechana and Basti Karma should be. Because Rona is there, Samrambe, Urdhvada Shodhana, then you give Basti Karma. That's what I usually do. Next please. Before, after is it almost healed. Next please. Before and after. Next. So I think now after 2 hours of my discussion, you understood this shloka. Hetu linga vashadam jnanam swasthatara parayanam. Patient comes with the linga. You have to find out what is its hetu, then give hetu vyadhi viparita chikitsa. Next please. Next. Satatadnya, what a physician should do? Research. Usually we tell now you should do research. Research. Satatadhyana, Vadaha, Paratantra Avalokana. Most important is Tadvidya Acharya Seva. Acharya Seva means what? Work along with the Acharya, understand, practical understanding of the theory. Then you practice it. So it is actually, it is a question, you are doing, in the Western science, doctors are not doing research. Who has done research, they give, this is the, with the data they give, these are the drugs, you should use this one. This doctor don't have any independence. What is told in their textbook, you should follow protocol. If you change, patient can go to court. You can't change. In Ayurveda, you have all the liberty. All the liberty. According to presentation, you can change the drug. Even your treatment may be against actual advice. In that condition needed, you can give your treatment with the logical analysis. Vina tarka ya siddhi, yadrichya siddhirti. Without tarka, if you give any siddhi, that is yadrichya. With the tarka, logical analysis, you can give any treatment according to your patient's presentation and your logical analysis. That is the liberty of Ayurveda given for all the physicians. Next, please. Thank you very much.
Nice presentation. We recap most of our basic concepts in nice way. And my question is, most of the patients are coming to the Ayurveda, that to Madhumeha patients, most of our diabetic patients, they are having already medicines with modern medicines. Their intention is to drop the modern medicine and switch on to the Ayurveda. One thing, some of the patients, they will come, they will avoid the modern medicine and they will start the Ayurveda medicine. So in such a type of cases, how can we plan the treatment for the those who are taking modern medicine? How we can plan the Ayurveda medicine? Along with we can start the medicine, or you can drop the modern medicine, or we start the Ayurveda medicine. How long we can give the medicines?
Yeah, you will have all withdrawal symptoms because all these drugs are prabhavi aushadis. Say aushadis, can you give me? In the aushadis, it works by rasa, guna, virya, vipaka. By these drugs work as amapachakam. Certain drugs are told for, according to karyakarana vivechana, by mathematical equation, we will analyze and give these drugs according to rasa, guna, virya, vipaka, according to dosha, viruddha you are giving. Some drugs, even though it is same rasa, guna, virya, vipaka, it works differently. We call it as prabhavya. It works by prabhava. If you see, for example, if you take a Yogaraja Guggulu, it works as a Vedanahara, Shotahara. According to Ayurveda, you say it is Vata Kafahara, that is Vata Kafaja, Shota, Vedana, this comes down. A Karyakarana Vivechana is there. If you take diclofenac sodium, how you will explain? Shota Vedana comes down. How it works? According to Ayurveda, you should explain how. By rasa, guna, virya, vipaka, it does not work. It works by its prabhava. Which one? Achintya, it comes as prabhava. Can you take prabhava aushadhi daily? Even Ayurveda, danti is there. It's a vamana and virechana curse. Can you take danti daily? What happens? It becomes visha. Patient will die out. Any prabhavi aushadhi, continuously you can't use. It used temporarily. As an amastambana or amapachana, or as a shodhana, shamana, for temporarily. Like that, these modern medicines, if you take continuously, a visha also, continuous if you take in small doses continuously, it becomes atmiya to him. Immediately if you withdraw, it causes its symptoms. All withdrawal symptoms, that symptoms will come again. In such conditions, patient comes with modern medicine. We can't withdraw immediately. There will be limitation. Along with that drug, if patient comes, you have to give Ayurveda drug along with that. Slowly you can withdraw if possible. But in all the patients, it's not possible. Only you can control his blood sugar, control his diabetes. But if we changes the lifestyle, if you give him all these treatments, ahara, vihara, vyayama, all these things, slowly as his sugar level comes down, he is maintained, you can withdraw the drug slowly within 3 to 6 months, if possible. If he does not change his lifestyle, then it is not possible. Along with that, you should give your drug. Then they will ask, what is the use of your drug? Why I should take? Definitely they will ask, why I should take your drug? If you are giving same drug, along with that, if you are giving drug. So what happens if you take this modern medicine continuously, after some time, that drug is not sufficient. The drug level should be increased, dosage should be increased. Patient goes, still there will be, it's only Amastamban occurred, but Dhatukshaya continuously going on. So if you give these drugs, that the happening of Dhatukshaya will be reduced, progress of the disease can be controlled. That is why you have to give your drug. And complications of diabetes, complication of the drug, that can be prevented with the Ayurveda treatment along with that. If patient changes the lifestyle, he is ready to change the lifestyle, definitely you can withdraw the drug. But the very important thing is patient should, it is all patient-centric. He should be ready to change his lifestyle. Then only your drug will be useful. That you have to do. You should convince the patient. You should take this drug. It will help you. Slowly, if you change the lifestyle, you can withdraw. Otherwise, along with that, if you take this Ayurveda drugs, the complications of drug and complications of disease can be prevented. That is the advantage of Ayurveda treatment. Both in hypertension and diabetes, both, it is the same thing.
Though fasting is advised as a amapachana, can we advise fasting in diabetic patients with high sugar levels?
Yeah, upavasa can be done. Advised like drastic upavasa cannot be done. But patient is in avarana state, definitely he can do. So you should adjust both modern medicine and Ayurveda drugs. That is prerogative of physician. You should do according to situation. Why we can't prescribe hypothetically here itself, you stop the drug and do upavasa continue. That cannot be done. So that is according to presentation you should do.
ಸಿರಾವೇದ ಮಾಡಿದಾಗ ಏನೂ ಆಗಿರಲಿಲ್ಲ, ಬಟ್ 2 ಕೇಸಲ್ಲಿ ಸಿರಾವೇದ ಮಾಡಿ ನೆಕ್ಸ್ಟ್ ದಿನನೇ ಪಿಡಕ ಉತ್ಪತ್ತಿಯಾಗಿ ಲೈಕ್ ಸೆಲ್ಯುಲೈಟಿಸ್ ಥರ ಆಯ್ತು ಅದು. ಆಮೇಲೆ ಕುಷ್ಠ ಚಿಕಿತ್ಸೆ ಮಾಡಿದ್ಮೇಲೆ ಉಪಶಯ ಸಿಕ್ತು, ಬಟ್ ಇಟ್ ಹ್ಯಾಸ್ ಟೇಕನ್ ವೆರಿ ಲಾಂಗ್ ಟೈಮ್ ಟು ಗೆಟ್ ಔಟ್ ಆಫ್ ದಿಸ್ ಕಂಡೀಷನ್. ಅದು ಕಾಸ್ ಅಂದರೆ ಬಹುದೋಷಾವಸ್ಥೆಯಲ್ಲಿ ಅಲ್ಪಶೋಧನ ಆಗಿದ್ದ ಅಥವಾ ಏನು ಕನ್ಸಿಡರ್ ಮಾಡ್ಬೇಕು ಸರ್ ಅದು?
ಅಲ್ಲ, ಸಿರಾವೇದ ನೀವು ಹೇಗೆ ಮಾಡಿದ್ರಿ?
ನೀಡಲಿಂದ ಮಾಡಿದ್ದು ಸರ್.
ಅಲ್ಲ ಅದರ ಪ್ರಿಪರೇಷನ್ ಅಂತ ಮಾಡಿದ್ರಿ ಪೇಷಂಟ್?
ಟೈ ಮಾಡಿ, ಥೈಯಿಂದ ಪೂರ ಟೈ ಮಾಡಿ.
ಅಲ್ಲ, ಪೇಷಂಟ್ಗೆ ಪ್ರಿಪೇರ್ ಮಾಡಿದಿರಿ ಇಲ್ವೋ?
ಪ್ರಿಪೇರ್ ಇನ್ ದ ಸೆನ್ಸ್ ಆ
ಪೂರ್ವಕರ್ಮ
ಇಲ್ಲ ಸರ್, ಸ್ನೇಹಪಾನ ಏನು ಮಾಡಿಸಿರ್ಲಿಲ್ಲ. ಡೈರೆಕ್ಟ್
ಸ್ನೇಹಪಾನ ಮಾಡುವ ಅಗತ್ಯ ಇಲ್ಲ. ಪೇಷಂಟಿಗೆ ಆಲ್ರೆಡಿ ಅದು ಇರುವಾಗ ಅಲ್ಲಿ ಇನ್ಕ್ರೀಸ್ ಆದ ನಿಮ್ಮ ಸಿರಾವೇದಂತ ಆಗಿರ್ಲಿಕ್ಕಿಲ್ಲ. ಸಿರಾವೇದ ಮಾಡಿದ್ರು ಅಲ್ಲಿ ಆಗ್ತಿತ್ತೇನು?
ಅಲ್ಲ, 2 ಸರಿ ಮಾಡಿ ನೆಕ್ಸ್ಟ್ ಡೇಗೆ ಬಂದು ಸರ್. 2 ಕೇಸಿ ಹಂಗೆ
ಇಲ್ಲ, ಆಗುವ ಚಾನ್ಸ್ ಉಂಟು, ಆಗ್ಬೋದು, ಆಗ್ಲಿಕ್ಕಿಲ್ಲ ಅಂತ ಹೇಳಲಿಕ್ಕೆ.
ಅದು ಟಿಪಿಕಲ್ ಆಗೇ ಬಂದು ಸರ್. ಒಂದು 100 ml ವರೆಗೂ ಡ್ರಾ ಮಾಡಿದ್ದೆ.
ಅಲ್ಲಿ ಸಿರಾವೇದಲ್ಲಿ ನೀವು ಡ್ರಾ ಮಾಡುವುದಲ್ಲ, ಯು ಆರ್ ಎಲೋಯಿಂಗ್
ದೊಡ್ಡದಿತ್ತು ಸರ್ ಪೇಷಂಟ್ಗೆ. ಅದು ಅಂದ್ರೂ ಫಸ್ಟ್ ಟೈಮ್ ಅವ್ರಿಗೆ ಅದು ಆ ಪ್ರೋಸೆಸ್ ಒಳಗೆ ಹೋಗೋದ್ರಿಂದ ಅದು ಪ್ಯಾನಿಕ್ ಆಗೋದು ಬೇಡ ಅಂತೇಳಿ ಒಂದು ಯೂಶಲಿ ಒಂದು ಸೇಫರ್ ಝೋನಲ್ಲಿ 100 ml ವರೆಗೂ ಡ್ರಾ ಮಾಡಿದ್ವಿ ಸರ್.
ಅಲ್ಲ, ಅಲ್ಲಿ ನೀವು ಇದು ಮಾಡಬಾರ್ದು, ನೀವು ನಿಮ್ಮಷ್ಟೇ ಸ್ಟಾಪ್ ಮಾಡಬಾರ್ದು.
ಮೇ ಬಿ ಅದು
ಯು ಶುಡ್ ಎಲೋ ಬ್ಲಡ್ ಸ್ಟಾಪ್ ಬೈ ಇಟ್ ಸೆಲ್ಫ್. ಅದರ್ವೈಸ್ ಅದು ಸಮ್ಯಕ್ ಶುದ್ಧ ಆಗಿರುವುದಿಲ್ಲ, ರೋಗೋತ್ಪತ್ತಿ ಇದಾಗಿರ್ಬೋದು, ಆಗಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ಲ, ಹೇಳಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಸಿರಾವೇದದಲ್ಲಿ ನಾವು ಸ್ಟಾಪ್ ಮಾಡಲಿಕ್ಕಿಲ್ಲ, ಅದುವೇ ಸ್ಟಾಪ್ ಆಗಬೇಕು. ಅದಿರ್ಬೋದು, ಅದು ಅಲ್ಲಿ ಒಟ್ಟಿಗೆ ಅಲ್ಲಿ ಕ್ರಿಮಿ ಸಂಸರ್ಗ ಆದರೆ ಇದಾಗಿರ್ಬೋದು, ಚಾನ್ಸಸ್ ಇರ್ತಾರೆ. ನೀವು ಅಭ್ಯಂಗ ಮಾಡಿ ಇದು ಮಾಡುವ ಕ್ರಿಮಿ ಸಂಸರ್ಗ ಆಗಿರೋ ಚಾನ್ಸ್ ಉಂಟು.
ಅಭ್ಯಂಗ ಏನೂ ಆಗಿರಲಿಲ್ಲ ಸರ್, ಡೈರೆಕ್ಟ್ ಅದು
ಅಲ್ಲ, ಆಗ್ಲಿಕ್ಕಿಲ್ಲ ಅಂತ ಹೇಳಿ ಸರ್, ಎಂತೂ ಆಗಿರ್ಬೋದು, ಹೇಳಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ಲ. ಹೈಪೋಥೆಟಿಕಲಿ ವಿ ಕಾಂಟ್ ಸೇ ಎನಿಥಿಂಗ್ ಕ್ಯಾನ್ ಹ್ಯಾಪನ್, ಯು ಹ್ಯಾವ್ ಟು ಟ್ರೀಟ್ ಅಕಾರ್ಡಿಂಗ್ಲಿ, ದಟ್ಸ್ ಆಲ್.
ಅಲ್ಲ, ಅದರಲ್ಲಿ ಏನು ಮಿಸ್ಟೇಕ್ ಆಗಿರ್ಬೋದು ಅಂತ ಅದು ಕೇಳಿದೆ ಸರ್.
ಕ್ರಿಮಿ ಸಂಸರ್ಗ ಆಗಿರ್ಬೋದು, ಇನ್ಫೆಕ್ಷನ್ ಆಗಿರ್ಬೋದು. ಈಗ ಆಲ್ರೆಡಿ ಅಲ್ಲಿ ದೋಷ ವೈಷಮ್ಯ ಇರುವಾಗ ಕ್ರಿಮಿ ಸಂಸರ್ಗ ಆಗೋ ಚಾನ್ಸ್ ಇರ್ತದೆ, ಹಾಗೇ ಆಗ್ಬೋದು. ಅದಾಗೋ ಇಲ್ಲ, ಸೆಲ್ಲೈಟಿಸ್ ಆಗ್ಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ಲ, ಹಾಗೆ ಸ್ಪ್ರೆಡ್ ಆಗಿರ್ಬೋದು ಇಮಿಡಿಯೇಟ್.
ತುಂಬ ಸ್ಪ್ರೆಡ್ ಆಗಲಿಲ್ಲ ಸರ್ ಆ ಜಾಗದಲ್ಲಿ, ಒಂದು
ಅದೇ ಅಷ್ಟು ಜಾಗ ಅಷ್ಟು ಸ್ಪ್ರೆಡ್ ಆಗಿರ್ಬೋದು, ಆಗೋ ಚಾನ್ಸ್ ಇದೆ. ಸೆಲ್ಲೈಟಿಸ್ ಆಗ್ಬೋದು, ಡೆಫಿನೆಟ್ಲಿ ಆಗ್ತದೆ.
ಫಸ್ಟಿಗೆಲ್ಲ ಅಲೋಪತಿಕ್ ಮೆಡಿಸಿನ್ಸ್ ತಗೊಂಡು ಕಾನ್ಫಿಡೆಂಟ್ ಆಗಿರ್ತಾರೆ. ಪೆರಿಫೆರಲ್ ನ್ಯೂರೈಟಿಸ್, ಡಯಾಬಿಟಿಕ್ ನೆಫ್ರೋಪತಿ, ಡಯಾಬಿಟಿಕ್ ರೆಟಿನೋಪತಿ ಆ ಥರ ಆದಾಗ ಬರ್ತಾರೆ. ಆ ಕಂಡೀಷನನ್ನು ನಾವು ಹೇಗೆ ಟ್ಯಾಕಲ್ ಮಾಡಬೇಕು?
ಯಾ ಇಟ್ಸ್ ಎ ವೆರಿ ಗುಡ್ ಕ್ವೆಶ್ಚನ್. ಇದರ ಸ್ರೋತಸ್ಸುಗಳು ದೌರ್ಬಲ್ಯಾಗಿ ಯು ಕ್ಯಾನ್ ಹ್ಯಾವ್ ದಿ ಆಲ್ ದಿಸ್ ನೆಫ್ರೋಪತಿ, ರೆಟಿನೋಪತಿ, ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್ ಕ್ಯಾನ್ ಬಿ ಹ್ಯಾಪನ್. ದೇರ್ ವಿಲ್ ಬಿ ರಸಾಯನ ದೌರ್ಬಲ್ಯಂ. ಆ್ಯಕ್ಚುಲಿ ರಸಾಯನ ಚಿಕಿತ್ಸೆ ಇದಕ್ಕೆ ಮಾಡಬೇಕಾದ್ದು. ಒಂದು ಮಧುಮೇಹ, ಇನ್ನೊಂದು ರಸಾಯನ ಚಿಕಿತ್ಸೆ. ಇದೆರಡರಲ್ಲಿ ಮಾಡಿ ಯು ಶುಡ್ control his disease. If you give this Ayurveda treatment, you should first we should control his madhumeha and give rasayana chikitsa. By this you can prevent his further complication. Already complicated, you can't reverse much, but complication can be further complication prevent ಮಾಡ್ಬೋದು. This main thing we can prevent further complication. That is urdu adasha rakshet balancha nityam ನರಸ್ಯ ತದ್ರಕ್ಷಿತಂ ವ್ಯಾಧಿಬಲಂ ನಿಹಂತಿ. ದಟ್ ಈಸ್ ವಾಟ್ ಸುಶ್ರುತ ಹ್ಯಾಸ್ ಟೋಲ್ಡ್. ರಸಾಯನ ಚಿಕಿತ್ಸೆ ಇಸ್ ದಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಫ್ ಚಾಯ್ಸ್, ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ಸೊ ಅದು ರಸಾಯನ ಚಿಕಿತ್ಸೆ ಮಾಡುವಾಗ ಅದು ಇದರಲ್ಲಿ ಕಫವಾತಹರ ರಸಾಯನವೇ ಮಾಡಬೇಕಾಗ್ತದೆ. ನಾಟ್ ವಾತವೃದ್ಧಿ, ಇದು ಯಾವುದು ಬ್ರಹ್ಮಣ ಮಾಡುವ ರಸಾಯನ ಮಾಡಲಿಕ್ಕೆ ಆಗುವುದಿಲ್ಲ. ರೂಕ್ಷಣ ರಸಾಯನ, ಕಫವಾತಹರ ರಸಾಯನಗಳನ್ನು ಮಾಡಬೇಕಾಗ್ತದೆ. ಮೆನಿ ದಿ ಡ್ರಗ್ ಆಫ್ ಚಾಯ್ಸ್ ಇಸ್ ಆಮಲಕ್ಕಿ ರಸಾಯನ, ಆಮಲಕ್ಕಿ ಆ್ಯಂಡ್ ಹರಿದ್ರ ರಸಾಯನ. ದಿಸ್ ವೆರಿ ಗುಡ್ ಟ್ರೀಟ್ಮೆಂಟ್. These things can be utilized. A patient of acute is there, you do takradara and basti karma. Especially Mahamanjishtadi Kashaya Basti and Bihasindava Taila for Anvasana. ತುಂಬ ಬಾಕಿ ಯಾವುದೇ ಬ್ರಹ್ಮಣ ಅನ್ವಾಸನ ಕೊಡಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಬೃಹತ್ಸೈಂಧವಾದಿ ಅನುವಾಸನ ಯು ಕ್ಯಾನ್ ಗಿವ್ ಆ್ಯಂಡ್ ಮಹಾಮಂಜಿಷ್ಟಾದಿ ಕಷಾಯ ಫಾರ್ ನಿರುಹ ಆ್ಯಂಡ್ ತಕ್ರಧಾರ. ದೀಸ್ ಆರ್ ವೆರಿ ಗುಡ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇನ್ ಪೆರಿಫೆರಲ್ ನ್ಯೂರೋಪತಿ. ಇವನ್ ರೆಟಿನೋಪತಿ ಯು ಕ್ಯಾನ್ ಗಿವ್ ತಕ್ರಧಾರ ಆ್ಯಂಡ್ ತರ್ಪಣ ಚಿಕಿತ್ಸಾ ಯು ಕ್ಯಾನ್ ಗಿವ್. ದಟ್ ಈಸ್ ತಿಕ್ತ ರಸದ್ದು ಘೃತದ್ದು ತರ್ಪಣ, ಎಸ್ಪೆಷಲಿ ಪಟೋಲಾದಿ ಘೃತ or ಮಹಾತಿಕ್ತ ಘೃತ. ಮಹಾತಿಕ್ತ ಘೃತ ಇಸ್ ಆಮಲಕ್ಕಿಯದ್ದು ಘೃತ. ದಟ್ ಕ್ಯಾನ್ ಬಿ ಯುಟಿಲೈಸ್ಡ್ ಫಾರ್ ದಿ ತರ್ಪಣ. ಇದರಿಂದ ರೆಟಿನೋಪತಿ ತುಂಬ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗ್ತದೆ. ಬಟ್ ಆಲ್ರೆಡಿ ಗಾನ್, ರಿವರ್ಸ್ ವಿಲ್ ಬಿ ವೆರಿ ಲೆಸ್. ಬಟ್ ಫರ್ದರ್ ರಿವರ್ಸ್ ಪ್ರೋಗ್ರೆಸ್ ಆಫ್ ಡಿಸೀಸ್ ಯು ಕ್ಯಾನ್ ಸ್ಟಾಪ್. ದಟ್ ಈಸ್ ದಿ ಅಡ್ವಾಂಟೇಜ್. ಆ್ಯಂಡ್ ತಲೆಗೆ ಪಿಚ್ಚು ಇಡ್ಬೋದು ಇದರದ್ದು. ಆಮಲಕ್ಕಿಯದ್ದು ವಾಟ್ ಐ ಹ್ಯಾವ್ ಸೀನ್ ಈಸ್ ಸಮ್ ಪೇಷಂಟ್ ಜಸ್ಟ್ ಯು ಗಿವ್ ಆಮಲಕ್ಕಿ ಆ್ಯಂಡ್ ತಕ್ಕದ್ದು ಡೈಲಿ ಪಿಚ್ಚು ಬಿಟ್ಟರೆ ಒಂದು ಶುಗರ್ ಅದರಲ್ಲೇ ಕಡಿಮೆ ಆಗ್ತದೆ. ಸುಮಾರು ಜನರಿಗೆ ಡ್ರಗ್ಗೆ ಕೊಡುವುದು ಅದರಲ್ಲೇ ಕಡಿಮೆ ಆಗಿ ನೋಡಿದೆ. ಬಟ್ ಅಲಾಂಗ್ ವಿತ್ ದ್ಯಾಟ್ ಇಫ್ ಯು ಗಿವ್ ದಿ ಡ್ರಗ್ಸ್ ಇಟ್ ವಿಲ್ ರೆಡ್ಯೂಸ್, ಯು ಕ್ಯಾನ್ ಯುಟಿಲೈಸ್. ಬಟ್ ಯು ಡೋಂಟ್ ಥಿಂಕ್ ವಿ ಕ್ಯಾನ್ ಕ್ಯೂರ್ ದಿ ಡ್ರಗ್ ಡಿಸೀಸ್ ಡೈರೆಕ್ಟ್ಲಿ ಬೈ ಗಿವಿಂಗ್ ಸಮ್ ಡ್ರಗ್ಸ್ ವಿ ಕ್ಯಾನ್ ಕ್ಯೂರ್ ಲೈಕ್ ದಟ್. ಈಚ್ ಪೇಷಂಟ್ ಈಸ್ ಯುನಿಕ್. ಅದು ಇಂಡಿವಿಜುವಲಿಸ್ಟಿಕಲಿ ಡಯಾಗ್ನೋಸ್ ಮಾಡಿ ನೀವು ಡ್ರಗ್ ಫಾರ್ಮುಲೇಷನನ್ನು ಡಿಸೈಡ್ ಮಾಡಬೇಕು, ಪರ್ಸನ್ ಟು ಪರ್ಸನ್ ಆ್ಯಂಡ್ ಟೈಮ್ ಟು ಟೈಮ್. ಮತ್ತು ಸೀಸನ್ ಪ್ರಕಾರವೂ ಚೇಂಜ್ ಮಾಡಬೇಕಾಗ್ತದೆ. ಈಗ ಸಮ್ಮರಲ್ಲಿ ಇದ್ದದ್ದೇ ಟ್ರೀಟ್ಮೆಂಟ್ ವಿಂಟರಲ್ಲಿ, ರೈನಿ ಸೀಸನ್ ಹಾಗೂ ಆಗೋದಿಲ್ಲ. ಅದು ಋತು ಪ್ರಕಾರವೂ ಚೇಂಜ್ ಆಗ್ತದೆ, ಟೈಮ್ ಪ್ರಕಾರವೂ ಚೇಂಜ್ ಆಗ್ತದೆ, ಮತ್ತು ಇದರ ಪ್ರಕಾರವೂ ಚೇಂಜ್ ಆಗ್ತದೆ, ವ್ಯಾಧಿಯ ಅವಸ್ಥೆ ಪ್ರಕಾರವೂ ಚೇಂಜ್ ಆಗ್ತದೆ. ಬಟ್ ದಟ್ ಶುಡ್ ಬಿ ಡಿಸೈಡೆಡ್ ಬೈ ಟ್ರೀಟಿಂಗ್ ಫಿಸಿಷಿಯನ್. ಬಟ್ this mathematical equation just you can utilize in your practice. So I wanted to convey my this one is this mathematical equation. So individual physician is a scientist. All or you become scientist then. ನೀವು ಬರೆಯೊಬ್ಬರು ಕೂಡ ಕಾರ್ಯಕಾರಣ ವಿವೇಚನೆ ಮಾಡಿ ಸೈಂಟಿಸ್ಟ್ನಾಗೆ ವರ್ಕ್ ಮಾಡೋದು. ಇಟ್ ಈಸ್ ಎ ಪೇಷಂಟ್ಸ್ ಆರ್ ಲ್ಯಾಬೊರೇಟರಿ. ಇದುವೇ ಎನಿಮಲ್ ಅಂತ ಹೇಳೋದಿಲ್ಲ, ಒಂದು ಸಬ್ಜೆಕ್ಟ್. They are subjects. You are utilizing this mathematical equation. Definitely you can utilize. Each person is a different subject. You are doing a research daily. Kaphapitta idre Arogyavardhini is the best drug, what I say. And Amalaki Rasayana and Arogyavardhini. And Vasanta Kusmakar Rasa. This is slightly costly. ಆರೋಗ್ಯವರ್ಧಿನಿ ಯಾಕೆ ಹೇಳ್ತೇನೆ ಅಂತ ಹೇಳಿದರೆ, ಅಲ್ಲಿ ಶ್ರೋತೋರೋಧ ಇರ್ತದೆ. ಶ್ರೋತೋರೋಧವನ್ನು ಓಪನ್ ಮಾಡಬೇಕಿದ್ರೆ ಕಫವಾತಹರ ದ್ರವ್ಯ ಈ ಆರೋಗ್ಯವರ್ಧಿನಿ ಅಲ್ಲಿ ಡ್ರಗ್ ಎಂತ ಅಂತಂದರೆ ಒಂದು ತ್ರಿಫಲ ಇರ್ತದೆ, ಮತ್ತೊಂದು ಇದು ಕಟುಕರೋಹಿಣಿ. ಕಟುಕರೋಹಿಣಿ ಅದು ಆ್ಯಕ್ಚುಲಿ ಉಷ್ಣ. ಅದು ಈಗ ಯೂಶ್ವಲಿ ನಾವು ಪಿತ್ತ ರೇಚಕ ಅಂತ ಹೇಳಿದ್ರೆ ಕಂಪ್ಲೀಟ್ ಪಿತ್ತರೇಚ ಅಲ್ಲ, ಪಿತ್ತ ಜಲಿ ಅಂಶವನ್ನು ಕಡಿಮೆ ಮಾಡ್ತದೆ, ಅದರ ಆಗ್ನೇಯ ಅಂಶ ಹೆಚ್ಚಾಗ್ತದೆ ಶ್ರೋತೋ ಶೋಧನ ಆಗಿ. ಸೊ ಅದನ್ನು ಸ್ವಲ್ಪ ನೋಡಿಕೊಳ್ಬೇಕು. ಕೊಡುವಾಗ ಪೇಷಂಟಿಗೆ ಉಷ್ಣ ಆಗ್ತದೆ, ನೋಡಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಬೇಕು. ಹಾಗಿದ್ದರೆ definitely it is a drug of choice in many of the diabetic patients. One, not only in retinopathy, all pathies, ಯಾವುದು ರೆಟಿನೋಪತಿ, ನೆಫ್ರೋಪತಿ, ನ್ಯೂರೋಪತಿ, ಎಲ್ಲ ಪತಿಯಲ್ಲಿ ಕೂಡ ದಟ್ ಡ್ರಗ್ ಕ್ಯಾನ್ ಬಿ ಯುಟಿಲೈಸ್ಡ್ ಅಲಾಂಗ್ ವಿತ್ ದ ಅದರ್ ಡ್ರಗ್ಸ್. ಅದಕ್ಕೆ ದೋಷ ವ್ಯಾಧಿ ವಿಪರೀತ ಚಿಕಿತ್ಸೆ, ಯಾವ ದೋಷ ಇನ್ವಾಲ್ವ್ ಆಗಿದೆ ಮತ್ತು ವ್ಯಾಧಿಗೆ ಒಂದು ಡ್ರಗ್ ವ್ಯಾಧಿ ವಿರುದ್ಧ ಇದ್ದರೆ ಒಂದು ದೋಷ ವಿರುದ್ಧವಾಗಿ ನೀವು ಡಿಸೈಡ್ ದೋಷ ವ್ಯಾಧಿ ವಿಪರೀತ ಚಿಕಿತ್ಸೆ ಮಾಡಬೇಕು. ಪಿತ್ತದ ಅಂಶ ಹೆಚ್ಚಿದ್ದರೆ ಕಾಮಧೇನು ಮುಕ್ತ, ಸೂತ್ಶೇಖರ ಇದನ್ನೆಲ್ಲ ಯೂಸ್ ಮಾಡ್ಬೋದು. ಕಫದ ಅಂಶ ಹೆಚ್ಚಿದ್ದರೆ ಆರೋಗ್ಯವರ್ಧಿನಿ, ಇದೆಲ್ಲ ಇದು ರೂಕ್ಷಣ ಇರುವಂಥದ್ದು ಉಷ್ಣದ ಡ್ರಗ್ಗಳನ್ನು ಯೂಸ್ ಮಾಡೋದು ಅಕಾರ್ಡಿಂಗ್ ಟು ಪ್ರೆಸೆಂಟೇಷನ್. ದಟ್ ಈಸ್ ಆಲ್ ಡಿಪೆಂಡೆಂಟ್ ಆನ್ ಯುವರ್ ಪ್ರೆಸೆಂಟೇಷನ್ ಆಫ್ ದಿ ಪೇಷಂಟ್. ಡೆಫಿನೆಟ್ಲಿ ಯು ಕ್ಯಾನ್ ಯುಟಿಲೈಸ್.
ಸರ್ ಶಶಿಕಾಂತ್ ಅಂತೇಳಿ, ನಮ್ಮದು ಈಗ ನಾವು ಆಯುರ್ವೇದ ಮತ್ತು ಅಲೋಪತಿ ಎರಡೂ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋಂಥ ಕ್ಲಿನಿಕ್ ನಮ್ಮದು. ನಾವು ಫಸ್ಟ್ ಡ್ರಗ್ ಆಫ್ ಚಾಯ್ಸ್ ಈಗ ಡಯಾಬಿಟೀಸಲ್ಲಿ ಏನಿತ್ತು ಅಂತಂದರೆ ನಾವು ಆಯುರ್ವೇದನ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತೀವಿ. ಈಗ ಯಾವಾಗ ಕಂಟ್ರೋಲ್ ಬರಲ್ಲ ಅನ್ನೋಂಥ ಪರಿಸ್ಥಿತಿಲಿ ಅಲೋಪತಿಗೆ ಶಿಫ್ಟ್ ಆಗ್ತೀವಿ ನಾವಲ್ಲಿ. ಆ ಸಂದರ್ಭದಲ್ಲಿ ನಾವು ಅಲೋಪತಿ ಆಯುರ್ವೇದ ಡ್ರಗ್ ಅಟ್ ಎ ಟೈಮ್ ಕೊಡ್ಬೋದು ಜೊತೆಗೆ, ಅಥವಾ ಅದ್ರದ್ದು ಟೈಮ್ ಡ್ಯೂರೇಷನ್ ಏನಾದ್ರು ಬೇರೆ ಬೇರೆ ಕೊಡಬೇಕು, ಹೇಗೆ ಅದು?
ಅಲ್ಲ, ಅಟ್ ಎ ಟೈಮ್ ಕೊಡೋದಕ್ಕೇನು ತೊಂದರೆ ಇಲ್ಲ. ಅದು ವರ್ಕ್ ವಿಧಾನವೇ ಬೇರೆ, ನಮ್ಮದು ವರ್ಕ್ ವಿಧಾನವೇ ಬೇರೆ. ಸೊ ಅದರಿಂದ ಅಟ್ ಎ ಟೈಮ್ ಕೊಡೋದ್ರಿಂದ ಏನು ತೊಂದರೆ ಇಲ್ಲ, ಅದರಿಂದ ಎಂತ ಆಗೋದಿಲ್ಲ. ಡ್ರಗ್ಗನ್ನು ನೀವು ಕೊಡುವಾಗ ಮಾತ್ರ ಜಾಗ್ರತೆ ಮಾಡು, ಹೈಪೋಗ್ಲೈಸಿಮಿ ಆಗ್ಬೋದು. ಈಗ ಆಲ್ರೆಡಿ ಪೇಷಂಟ್ ಒಂದು ಕಂಟ್ರೋಲ್ನಲ್ಲಿದೆ, ಶುಗರ್ ಕಂಟ್ರೋಲ್ ಇರೋ ಪೇಷಂಟಿಗೆ ನಿಮ್ಮ ಡ್ರಗ್ ಹಾಕಿದ ಕೂಡಲೇ ಹೈಪೋಗ್ಲೈಸಿಮಿ ಆಗ್ಬೋದು. ನೀವು ಅದಕ್ಕೆ ಒಂದು ಸ್ವಲ್ಪ ಜಾಗ್ರತೆ ಮಾಡು, ನೋಡಿಕೊಳ್ಳಬೇಕು. ನಿಮ್ಮ ಡ್ರಗ್ಗಿನಾಗ ಹೈಪೋಗ್ಲೈಸಿಮಿ ಆದರೆ ಅವರು ಎಂತ ಹೇಳ್ತಾರೆ, ಆಯುರ್ವೇದ ಮತ್ತೆ ತಗೊಂಡು ನನಗೆ ಜ್ವರ ಆಯಿತು ಹೇಳ್ತಾರೆ, ಅಥವಾ
ಅಲ್ಲಲ್ಲ
ಹೈಪೋಗ್ಲೈಸಿಮಿ ಆಗ್ಬೋದು.
ಸರ್ ನಮ್ದೇನಿರುತ್ತೆ, ಫಸ್ಟ್ ಲೈನ್ ಆಫ್ ಟ್ರೀಟ್ಮೆಂಟ್ ನಾವು ಆಯುರ್ವೇದ ಕೊಡ್ತಾ ಇರ್ತೀವಿ. ಇನ್ ಕೇಸು ಈಗ 250, 300 ಆಯುರ್ವೇದದಲ್ಲಿ ಕಂಟ್ರೋಲ್ ಆಗಲಿಲ್ಲ ಅಂದರೆ ನಮ್ಮ ಲೆವೆಲಿನ ಟ್ರೀಟ್ಮೆಂಟಲ್ಲಿ, ಅವಾಗ ನಾವು ಶಿಫ್ಟೆಡ್ ಟು ಮೆಟ್ಫಾರ್ಮಿನ್ ಅಂತ ಇಟ್ಕೊಳ್ಳಿ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್. ಮೆಟ್ಫಾರ್ಮಿನ್ನು ಮತ್ತು ಗ್ಲೂಕೋಸ್ಟಾಟ್ ಎರಡು ಅಟ್ ಎ ಟೈಮ್ ಒಟ್ಟೆ ತಿನ್ನಬಹುದು.
ಅಟ್ ಎ ಟೈಮ್ ಕೊಡ್ಬೋದು, ಎಂತ ಆಗೋದಿಲ್ಲ, ಖಂಡಿತ ಕೊಡ್ಬೋದು. ಆದರೆ ನೋಡಬೇಕು, ಹೈಪೋಗ್ಲೈಸಿಮಿ ಆಗದೆ ನೋಡಿಕೊಳ್ಬೇಕು ಅಷ್ಟೇ. ಖಂಡಿತ ಕೊಡ್ಬೋದು. ಆದರೆ ಯೂಶ್ವಲಿ ನೀವು ಮ್ಯಾಥಮೆಟಿಕಲ್ ಹೀಗೆ ಡಯಾಗ್ನೋಸ್ ಮಾಡಿ ಕೊಟ್ಟರೆ, ಯೂಶ್ವಲಿ ಈಗ ಪೇಷಂಟ್ 400 ಎಲ್ಲ ಬರ್ತಾರೆ ಫ್ರೆಶ್ ಕೇಸಸ್. ಇನ್ಸ್ಟೆಡ್ ಆಫ್ ಗಿವಿಂಗ್ ಮಾಡರ್ನ್ ಮೆಡಿಸಿನ್, ನೀವು ಆಯುರ್ವೇದ ಮೆಡಿಸಿನ್ನಲ್ಲಿ ಒಂದೂವರೆ ತಿಂಗಳು ನೀವು ಕಂಟಿನ್ಯೂ ಮಾಡಿದರೆ ಅವರ ಶುಗರ್ ಸ್ಲೋಲಿ ಲೆವೆಲ್ ಕಡಿಮೆ ಆಗ್ತಾ ಬರ್ತದೆ. ಈಗ ಇವತ್ತು ಕೊಟ್ಟು ನಾಳೆಗೆ ಆಗೋದಿಲ್ಲ, ಒಂದು 15 ದಿವಸ, 1 ತಿಂಗಳಾಗುವಾಗ ಕಂಟ್ರೋಲ್ ಆಗಿ ವಿದ್ದು ಓನ್ಲಿ ಆಯುರ್ವೇದ ಮೆಡಿಸಿನಲ್ಲಿ ಅವನು ಕಂಟ್ರೋಲ್ ಆದರೆ ನೀವು ಮೇಂಟೈನ್ ಮಾಡಲಿಕ್ಕೆ ಸುಲಭ. ಒಮ್ಮೆ ಅಲೋಪತಿಯಲ್ಲಿ ಕಂಟ್ರೋಲ್ ಮಾಡ್ತೇನೆ ಮತ್ತೆ ಆಯುರ್ವೇದಕ್ಕೆ ಶಿಫ್ಟ್ ಮಾಡುವ ಅಂತ ಹೇಳಿದರೆ ಅದು ತುಂಬ ಕಷ್ಟ ಆಗ್ತದೆ. ಒಮ್ಮೆ ಆಯುರ್ವೇದ ಮಾಡರ್ನ್ ಮೆಡಿಸಿನ್ ಕೊಟ್ಟು ಕಂಟ್ರೋಲ್ ಆದರೆ ಆಮಸ್ತಂಭನ ಆಗಿರ್ತದೆ, ನೀವು ಪಚನ ಮಾಡಲಿಕ್ಕೆ ತುಂಬ ಕಷ್ಟ ಆಗ್ತದೆ, ವಿಡ್ರಾ ಮಾಡಲಿಕ್ಕೆ. ಆಯುರ್ವೇದದಲ್ಲಿ ಫಸ್ಟಿಂದಲೇ ಕಂಟ್ರೋಲ್ ಮಾಡಿದರೆ ಅಲ್ಲಿ ಮೇಯ್ನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂತಂದರೆ ಅವರ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜ್ ಮಾಡಬೇಕಾದ್ದು. ಡ್ರಗ್ಗಿಗಿಂತ ಹೆಚ್ಚು ಇಂಪಾರ್ಟೆಂಟ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜ್ ಮಾಡಲಿಕ್ಕೆ ರೆಡಿ ಇಲ್ಲದ ಪೇಷಂಟ್ ಅಂತೇಳಿ ಆದರೆ ಹೆಚ್ಚಿನ ಅಂಶ ನಿಮಗೆ ಆಯುರ್ವೇದ ಟ್ರೀಟ್ಮೆಂಟ್ ಕಷ್ಟ, ಅವನಿಗೆ ಮಾಡರ್ನ್ ಮೆಡಿಸಿನ್ ಕೊಟ್ಟೇ ಕಂಟ್ರೋಲ್ ಮಾಡಬೇಕಷ್ಟೇ. ಆದರೆ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜ್ ಮಾಡ್ತಾರೆ ಅಂತೇಳಿ ಆದರೆ ಡೆಫಿನೆಟ್ ನೀವು ಆಯುರ್ವೇದ ಮೆಡಿಸಿನ್ನಲ್ಲೇ ಹೆಚ್ಚಿನ ಪೇಷಂಟ್ಸನ್ನು ಕಂಟ್ರೋಲ್ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ, ಇವನೊಂದು ಕ್ಯೂರ್ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ. ಅದಕ್ಕೆ ಪೇಷಂಟಿಗೆ ಸರಿಯಾಗಿ ಕನ್ವಿನ್ಸ್ ಮಾಡಿದರೆ, ಆ್ಯಕ್ಚುಲಿ ಆಯುರ್ವೇದ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡುವಾಗ ನಾವು ಜನರಲ್ ಪ್ರಾಕ್ಟೀಸ್ನ ಮಾಡಿದಾಗೆ 1 ನಿಮಿಷ 2 ನಿಮಿಷದಲ್ಲಿ ಆಗೋದಿಲ್ಲ. ಒಂದು ಪೇಷಂಟಿಗೆ ಸುಮಾರು 1/4 ಗಂಟೆ ಅರ್ಧ ಗಂಟೆ ತಗೊಳ್ಬೇಕಾಗ್ತದೆ. ಕೌನ್ಸಿಲಿಂಗ್ ಇಟ್ ಸೆಲ್ಫ್ ಇಸ್ ಎ ಟ್ರೀಟ್ಮೆಂಟ್, ಅವನ ಸೈಕಾಲಜಿಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗ್ತದೆ. ನಾವು ಮಾತಾಡೋದೇ ಅವನಿಗೆ ಟ್ರೀಟ್ಮೆಂಟ್. ಸೈಕಾಲಜಿಕಲ್ಲು ತುಂಬ ಟೆನ್ಸ್ ಇರ್ತಾರೆ, ಸೈಕಾಲಜಿಕಲ್ ಟೆನ್ಸ್ ಕಡಿಮೆ ಮಾಡಿದರೆ ಅವನಿಗೆ ಅರ್ಧ ಡಿಸೀಸಲ್ಲಿ ರೆಸಿಸ್ಟೆನ್ಸ್ ಕಡಿಮೆಯಾಗಿ ಅವನ ಶುಗರ್ ಲೆವೆಲ್ ಕಡಿಮೆ ಆಗ್ತದೆ. ಅದು ಮಾಡಿ ಒಟ್ಟಿಗೆ ನೀವು ಯೋಗ, ಪ್ರಾಣಾಯಾಮ, ಆಸನ, ವ್ಯಾಯಾಮ, ಮತ್ತು ಪಥ್ಯ, ಮತ್ತು ಆಹಾರ, ಮತ್ತು ಮೆಡಿಸಿನ್ ಹಾಗೆ ಮಾಡಿತ್ತು ಅಂತ ಹೇಳಿದರೆ ನಿಮಗೆ ಪೇಷಂಟ್ಸನ್ನು ಕಂಟ್ರೋಲ್ ಮಾಡಲಿಕ್ಕೆ ಸುಲಭ. ಆದರೆ ಅವರು ಅದಕ್ಕೆ ರೆಡಿಯೇ ಇಲ್ಲದ ಸುಮಾರು ಪೇಷಂಟ್ಸ್ ಇರ್ತಾರೆ, ನಾನು ರೆಡಿ ಇಲ್ಲ, ಅದೆಲ್ಲ ಆಗುವುದಿಲ್ಲ ನನಗೆ ಅಂತ ಹೇಳಿದರೆ ಕಷ್ಟ. ನೀವು ಮಾಡರ್ನ್ ಮೆಡಿಸಿನ್ ಒಟ್ಟಿಗೆ ಕೊಡಬೇಕಾಗ್ತದೆ. ಯು ಕ್ಯಾನ್ ಪ್ರಿವೆಂಟ್ ದೇರ್ ಕಾಂಪ್ಲಿಕೇಶನ್, ನಾಟ್ ದಿ ಡಿಸೀಸ್. ಸೊ ದ್ಯಾಟ್ ಇಸ್ ಡಿಪೆಂಡೆಂಟ್ ಆನ್ ದ ಪೇಷಂಟ್. ನಮಗೆ ಡಾಕ್ಟರ್ಸಿಗೆ ಅದು ಕಷ್ಟ, ಆಯುರ್ವೇದದಲ್ಲಿ ನಿಜವೇ ಕಷ್ಟ ಅಲ್ಲೇ ಇರೋದು.
ಸರ್ ನಮಸ್ತೆ, ಡಾಕ್ಟರ್ ಸಾವಿತ್ರಿ ಸರ್. ಸರ್ ಗೆಸ್ಟೇಷನಲ್ ಡಯಾಬಿಟೀಸ್ ಅಂದರೆ ಯಾವ ಥರ ಪ್ರೋಟೋಕಾಲ್ ಇರಬೇಕು ಸರ್ ಟ್ರೀಟ್ಮೆಂಟು?
ಆ್ಯಕ್ಚುಲಿ ಜೆಸ್ಟೇಷನ್ನಲ್ಲಿ ಇದುವೇ ಟ್ರೀಟ್ಮೆಂಟ್ ಹೀಗೆ ಕೊಡುವುದು, ಆದರೆ ಅದರಿಂದಾಗಿ ಗರ್ಭಕ್ಕೆ ಇದಾಗದಾಗೆ ಮಾತ್ರ ನೋಡಿಕೊಳ್ಬೇಕಾಗ್ತದೆ. ರೂಕ್ಷಣ ಚಿಕಿತ್ಸೆ ಕೊಡುವಾಗ ಗರ್ಭಕ್ಕೆ ರೂಕ್ಷಣ ಆಗಬಾರ್ದು, ಡ್ರಗ್ಗನ್ನು ಹೀಗೆ ಕೊಡಬೇಕಾಗ್ತದೆ.
ಸೊ ಯಾಕಂದರೆ IUGR ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಸೊ IUGR ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ, ಹೇಗೆ ಯಾವ ಥರ ಡೀಲ್ ಮಾಡ್ಬೇಕು ಸರ್?
ಅಲ್ಲ, ಅದು ಚಾನ್ಸಸ್ ಡೆಫಿನೆಟ್ ಇರ್ತದೆ. ನೀವು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾತ್ರ ಹೀಗೆ ಕೊಡಬೇಕು, ಗರ್ಭಕ್ಕೆ ಇದು ಆಗದ ಹಾಗೆ ನೋಡಬೇಕು. ಕಷಾಯಗಳನ್ನು ಇದನ್ನು ಹೆಚ್ಚು ರೂಕ್ಷ, ತುಂಬ ಉಷ್ಣ, ತುಂಬ ಕಟು ಇದನ್ನೆಲ್ಲ ಕೊಡುವ ಬದಲು ತಿಕ್ತರಸ ದ್ರವ್ಯಗಳನ್ನೇ ಕೊಡಬೇಕಾಗ್ತದೆ. ತಿಕ್ತರಸದಿಂದಲೂ ರೂಕ್ಷ ಆಗ್ಬೋದು. ಡೆಫಿನೆಟ್ ಇಟ್ ಈಸ್ ಎ ಚಾಲೆಂಜಿಂಗ್ ಸಿಚುವೇಶನ್. ಅದು ಟ್ರೀಟಿಂಗ್ ಫಿಸಿಷಿಯನ್ನೇ ಡಿಸೈಡ್ ಮಾಡಬೇಕು ಹಾಗೆ ಹೇಗೆ ಅಂತ. ಹಾಗೆ ಡೆಫಿನೆಟ್ ಇಟ್ ಇಸ್ ಎ ಚಾಲೆಂಜಿಂಗ್ ಸಿಚುವೇಶನ್.
ಕಾಂಬಿನೇಷನ್ ಕೊಡ್ಬೋದಾ ನಿಮ್ಮ ಅಪ್ರೋಚ್?
ಜುವೆನೈಲ್ನಲ್ಲಿ ಇಟ್ ಇಸ್ ಎ ಇನ್ಸುಲಿನ್ ಡಿಪೆಂಡೆಂಟ್ ಇರುತ್ತೆ ಅಥವಾ ಕಂಜನೈಟಲ್ ಇರ್ತದೆ. ಅದನ್ನು ನಿಮಗೆ ಹೆಚ್ಚಾಗಿ ಚೇಂಜ್ ಮಾಡಲಿಕ್ಕೆ ಆಗೋದೇ ಇಲ್ಲ. ಓನ್ಲಿ ಥಿಂಗ್ ಈಸ್ ವಿ ಕ್ಯಾನ್ ಯುಟಿಲೈಸ್ ಯೂಸ್ಫುಲ್ ದೆಮ್ ದಿ ಡೋಸೇಜ್ ಆಫ್ ಇನ್ಸುಲಿನ್ ಕ್ಯಾನ್ ಬಿ ರಿಡ್ಯೂಸ್ಡ್ ವಿತ್ ಆಯುರ್ವೇದ ಟ್ರೀಟ್ಮೆಂಟ್. ಅದೊಂದು ಡೆಫಿನೆಟ್. ಒಂದು ಡೋಸೇಜ್ ಚೇಂಜ್ ಮಾಡೋದು, ಇನ್ನು ರಸಾಯನ ಚಿಕಿತ್ಸೆ ಅವನಿಗೆ ಬೇರೆ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಆಗದಂಗೆ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ. ಇದು ಎರಡು ರೀತಿಯಲ್ಲಿ ನಾವು ಹೆಲ್ಪ್ ಮಾಡ್ಬೋದು. ಆದರೆ ಇನ್ಸುಲಿನ್ ಸ್ಟಾಪ್ ಮಾಡಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಮಾಡಿಲ್ಲ ಇದ್ರೆ ಸ್ವಲ್ಪ ಸಮಯ ಬೇಕಾಗ್ಬೋದು ಅವನಿಗೆ, ಹೇಳಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಈಗ ಸಣ್ಣ ಮಕ್ಕಳಿಗೆಲ್ಲ ಅಂತೇಳಿ ಆದರೆ ಅವ್ರಿಗೆ ಇನ್ಸುಲಿನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಬೇಕಾಗ್ತದೆ, ಇಲ್ಲದ್ರೆ ಅವ್ರದ್ದು ಇದಾಗ್ಬೋದು. ಅಂತೇಳಿ ನಿಮಗೆ ಇದು ಮಾಡ್ಬೋದು, ಆವರಣ ಚಿಕಿತ್ಸೆ ಮಾಡ್ಬೋದು. ಆದರೆ ಯಂಗ್ ಈಗ 8 ವರ್ಷದ ಮಕ್ಕಳು, 4 ವರ್ಷದ ಮಕ್ಕಳೆಲ್ಲ ಬರ್ತಾರೆ, 10 years ಅದು ಆಗಿರುವವರಿಗೆ ಬೇಕಾಗ್ತದೆ ಇನ್ಸುಲಿನ್. ವಿತ್ ಇನ್ಸುಲಿನ್ ಓನ್ಲಿ ಯು ಕ್ಯಾನ್ ಟ್ರೀಟ್, ಅದರ್ವೈಸ್ ಡೆಫಿನೆಟ್. ಆದರೆ ಡೋಸೇಜ್ ಆಫ್ ಇನ್ಸುಲಿನ್ ಕ್ಯಾನ್ ಬಿ ರಿಡ್ಯೂಸ್ಡ್. ದಿಸ್ ಆರ್ ಆಲ್ ನಿಮ್ಮ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಇನ್ಕ್ರೀಸ್ ಆದ ಹಾಗೆ ನಿಮಗೆ ಅದು ಬರ್ತಾ ಹೋಗ್ತದೆ. ಯುಟಿಲೈಸ್ ದಿಸ್ ಮ್ಯಾಥಮೆಟಿಕಲ್ ಕಾನ್ಸೆಪ್ಟ್ ಅಷ್ಟೇ, ಅದು ಮಾಡಿದರೆ ಆಯಿತು.
ಬರೀ ನವಣೆ ತಗೊಳೋದು, ಬರೀ ಸಾಮೆ ತಗೊಳೋದು ಆ ಥರನೋ, ಅಥವಾ ಮಿಕ್ಸ್ ಮಾಡಿ ಹಿಟ್ಟು ಮಾಡಿ ಮಲ್ಟಿಗ್ರೈನ್ ಹಿಟ್ಟು ಮಾಡ್ತಾರಲ್ಲ?
ಅಲ್ಲ, ಇದು ನಿಮಗೆ ಹಾಗೆ ಹೇಳಬೇಕಿದ್ರೆ ಫುಡ್ಡಲ್ಲಿ ಬರೀ ಪ್ರೋಟೀನ್ ಅಲ್ಲ, ಷಡ್ರಸೋಪೇತ ಆಹಾರವನ್ನು ಕೂಡ ಅದರಲ್ಲಿ ಮಧುರ ರಸ, ಆಮ್ಲ, ಇದು ಲವಣ ರಸದ ಆದಷ್ಟು ಕಡಿಮೆ ಮಾಡಿ ಕಟುತಿಕ್ತ ಕಷಾಯ ರಸ ದ್ರವ್ಯಗಳನ್ನು ಆದಷ್ಟು ತಗೊಳ್ಳುವಾಗ ಹೇಳಬೇಕು. ಅದರೊಟ್ಟಿಗೆ ನೀವು ಇದನ್ನು ಈಗ ಕಿಚಡಿ ಮಾಡಿ ತರಕಾರಿಗಳನ್ನು ಅದನ್ನೆಲ್ಲ ಮಿಕ್ಸ್ ಮಾಡಿ ಕಿಚಡಿ ಆಗುವಾಗ ಅದರಲ್ಲಿ ನವಣೆ ಅದನ್ನೆಲ್ಲ ಖಂಡಿತ ಎಲ್ಲ ಮಿಕ್ಸ್ ಮಾಡಿ ತಗೊಂಡ್ರು ಒಳ್ಳೆಯದು. ದಟ್ ಈಸ್ ಡೆಫಿನೆಟ್ಲಿ ಯೂಸ್ಫುಲ್ ಫಾರ್ ದೆಮ್.
ಅದೇ ಈಗ ಎಲ್ಲ ಧಾನ್ಯಗಳನ್ನು ಉದಾಹರಣೆ
ಮಿಕ್ಸ್ ಮಾಡಿ ತಗೊಳ್ಳೋದು ಒಳ್ಳೇದು, ಸಿಂಗಲ್ಗಿಂತ ಮಿಕ್ಸ್ ಮಾಡಿ ಒಳ್ಳೇದು.
ಹೌದು, ಮಿಕ್ಸ್ ಮಾಡ್ತಾರೆ, ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ. ನಾವು ಕೊಡ್ತಿದ್ದು ಸರಿನೋ ತಪ್ಪು ಅಂತ ಅನುಮಾನ ಬಂತು.
ಖಂಡಿತ ಅದು ಮಿಕ್ಸ್ ಮಾಡಿ ಕೊಡೋದು ಒಳ್ಳೇದು.
ಸರಿ ಸರಿ.
ಅದರೊಟ್ಟಿಗೆ ಸ್ವಲ್ಪ ತುಪ್ಪವೂ ಹಾಕಿ ಕೊಡೋದು ಒಳ್ಳೇದು. ದೇಶಿ ಆಕಳ ತುಪ್ಪ. ಅದು ಏನು ನೀವು ತುಪ್ಪ ಕೊಡದೆ ಬರೀ ರೂಕ್ಷಣ ಮಾಡಬೇಡಿ.
ಹೌದು ಹೌದು,
ಡೆಫಿನೆಟ್ಲಿ ದಟ್ ವಿಲ್ ಹಾರ್ಮ್ ದೇಯರ್ ಬ್ರೈನ್.
ಸರ್, ಇನ್ನೊಂದು ನೆಫ್ರೋಟಿಕ್ ಸಿಂಡ್ರೋಮಲ್ಲಿ ಯೂರಿನ್ ಪ್ರೋಟೀನ್ ಹೈ ಇರುತ್ತೆ. ಸೊ ಅಲೋಪತಿಗೆ ತೊಗೊಳ್ತಾ ಇರ್ತಾರೆ, ನಮ್ಮ ಹತ್ರ ಬರ್ತಾರೆ, ನಾವು ಕೊಟ್ಮೇಲೆ ಒಂದು ಲೆವೆಲ್ ಕಂಟ್ರೋಲ್ ಆಯಿತು. ಆಮೇಲೆ ಪೇಷಂಟು ಯಾರು ಹೇಳಿದ್ರಂತೆ ಆಯುರ್ವೇದ ತೊಗೊಂಡ್ರೆ ನಿಮಗೆ ಕಿಡ್ನಿ ಫೇಲ್ಯೂರ್ ಬಿಟ್ಬಿಟ್ರು. ಮತ್ತು 2ನೇ ಸತಿ ಪ್ರಾರಂಭ ಮಾಡಿದಾಗ ನಮಗೆ ಅಷ್ಟು ರಿಸಲ್ಟ್ ಸಿಗಲಿಲ್ಲ. ಇನ್ನೇನು ಮಾಡ್ಬೋದು ನೆಫ್ರೋಟಿಕ್ ಸಿಂಡ್ರೋಮಲ್ಲಿ?
ನೆಫ್ರೋಟಿಕ್ ಸಿಂಡ್ರೋಮಲ್ಲಿ ಅವರು ಯೂಶ್ವಲಿ ವಿತ್ ಸ್ಟೀರಾಯ್ಡ್ ಬರ್ತಾರೆ.
ಹೌದು,
ಸ್ಟೀರಾಯ್ಡ್ ಆಮಸ್ತಂಭನ.
ಸ್ಟೀರಾಯ್ಡ್ ಹೋಗಲಿಲ್ಲ ಸರ್ ಅವರು. ಆ ಪೇಷಂಟ್ ಸ್ವಲ್ಪ ಎಜುಕೇಟೆಡ್.
ಕೊಡದೇ ಇದ್ರೆ ಅಲ್ಲ, ವಿದ್ ಸ್ಟೀರಾಯ್ಡ್ ಆಗಲಿ ವಿದೌಟ್ ಸ್ಟೀರಾಯ್ಡ್ ಆಗಲಿ, ಅದು ಆ್ಯಕ್ಚುಲಿ ಕಫಜ ಪ್ರಮೇಹ ಚಿಕಿತ್ಸೆ ಮಾಡಬೇಕು. ಅದು ಪ್ರಮೇಹದಲ್ಲಿ ಬರುತ್ತೆ. ಕಫಜ ಪ್ರಮೇಹ ಚಿಕಿತ್ಸೆ ಮಾಡಿದರೆ ಆಯ್ತು. ಯೂಶ್ವಲಿ ನಿಮಗೆ ಕಂಟ್ರೋಲ್ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ. ಯಾವಾಗ ಅವನ ಅದು ಧಾತುಕ್ಷಯ ಅವಸ್ಥೆ ಹೋಗದಿದ್ರೆ, ಕಫಜ ಪ್ರಮೇಹ ಧಾತುಕ್ಷಯ ಆಗಿ ವಾತದ ಪ್ರಮೇಹಕ್ಕೆ ಶಿಫ್ಟ್ ಆಗದಿದ್ದರೆ ಆ ಸ್ಟೇಜಲ್ಲಿ ನಿಮಗೆ ಕ್ಯೂರ್ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತದೆ. ಸ್ಪೆಷಲಿ ಪಂಚವಲ್ಕಲ ಕಷಾಯಗಳು ಇದೆಲ್ಲ ಬಿಟ್ಟು ಗ್ರಂಥದಲ್ಲಿ ಹೇಳಿದ್ದಾರೆ, ಸಾಂದ್ರಮೇಹಕ್ಕೆ ಇರುವ ಚಿಕಿತ್ಸೆ. ಅದನ್ನು ಮಾಡಿದರೆ ಡೆಫಿನೆಟ್ ದೇರ್ ಇನ್ ಅಂಡರ್.
ನಾವು ಆ ಥರದಲ್ಲಿ ಚಂದ್ರಪ್ರಭಾವಟಿ ಕೊಟ್ಟು ಸುಮಾರು ಓಕೆ ಅಲ್ವ? ಚಂದ್ರಪ್ರಭಾವಟಿ
ಮಾತ್ರ ಸಾಕಾಗುದಿಲ್ಲ,
ಗೋಕ್ಷರಾದಿಗಳು
ಇದು ಕೊಡಬೇಕು. ಯಾವುದು ಅದರಲ್ಲಿ ಸಾಂದ್ರಮೇಹಕ್ಕೆ ಹೇಳುವುದೇ ಅವನು ಆಸನ ಮತ್ತೆ ಅಶ್ವತ್ಥ, ಅದು ಯೂಸ್ ಮಾಡಿದರೆ ಡೆಫಿನೆಟ್ ಕಂಟ್ರೋಲ್ ಬರ್ತದೆ. ವರುಣ, ಅಶ್ವತ್ಥ,
ಅದೇ ವರುಣ, ಪುನರ್ನವ, ಗೋಕ್ಷಿರ ಇವೆಲ್ಲ ಮಿಕ್ಸ್ ಮಾಡಿ ಸ್ವಲ್ಪ ದಿನ ಟ್ರೈ ಮಾಡಿದೆ, ತುಂಬ ಕಂಟ್ರೋಲ್ ಬಂತು. ಆಮೇಲೆ ಪೇಷಂಟ್ಸ್ ಬಿಟ್ಟರು ಯಾರು ಹೇಳಿ, ಮತ್ತೆ ಅದನ್ನ
ಪುನಃ ಅದೇ ಅದು ಸ್ವಲ್ಪ ಲಾಂಗ್ ಟರ್ಮ್ ತಗೊಳ್ಬೇಕು. ಅದು ಕಫಜ ಪ್ರಮೇಹ ಚಿಕಿತ್ಸೆ.
ಹೌದು ಸರ್, ಕಫಜ. ಈಗ
ರೇನಲ್ ಈಗ ಮಧುಮೇಹ ಅಂದ್ರೆ ಇದೀಗ ನಾವು ಹೇಳಿದ್ರೆ ಈ ಇದು ಕಫಜ ಪ್ರಮೇಹದಲ್ಲಿ ನೆಫ್ರೋಟಿಕ್ ಸಿಂಡ್ರೋಮ್ ಅದೆಲ್ಲ ಬರ್ತದೆ. ಪಿತ್ತಜ ಗ್ಲೋಮೆರುಲರ್ ನೆಫ್ರೈಟಿಸ್ ಅದೆಲ್ಲ ಬರ್ತದೆ, ಅದು ಪಿತ್ತಜದ್ದು. ಅದನ್ನೆಲ್ಲ ನೋಡಿ ನೀವು ಅದಕ್ಕೆ ಬೇಕಾದ ಚಿಕಿತ್ಸೆಯನ್ನು ಕೊಟ್ಟರೆ ಆಯ್ತು.
ಈಗ ನಾವು ಕೊಡ್ತಿರೋ ಈ ಪುನರ್ನವ, ಗೋಕ್ಷಿರ, ವರ್ಣ ಸ್ವಲ್ಪ ಲಾಂಗ್ ಟರ್ಮ್ ಕೊಡ್ಬೋದಲ್ಲ?
ಖಂಡಿತ ಕೊಡ್ಬೋದು. ಅದರಲ್ಲಿ ಅಶ್ವತ್ಥ ಮತ್ತೆ ಇದನ್ನು ಹಾಕಿದ್ರೆ ಒಳ್ಳೇದು.
ಲಕ್ಷ
ಅಶ್ವತ್ಥ ಅಶ್ವತ್ಥ ಆಸನ ವಿಜಯಸಾರ ಅಂತ ಹೇಳಿದ್ದಾರೆ, ಅಲ್ಲಿ ಉಂಟದು.
ಹೊನ್ನೆ
ಹೌದು, ಅದನ್ನೆಲ್ಲ ಯೂಸ್ ಮಾಡಿದರೆ ಡೆಫಿನೆಟ್ ಅದು ಕಂಟ್ರೋಲ್ ಬರ್ತದೆ.
ಸೊ ನಾವು ಇದಕ್ಕೆ ಬೇಕಾದ್ರೆ ಅಶ್ವತ್ಥ ಮತ್ತೆ ಇದನ್ನ ಹೊನ್ನೆ ಸೇರಿಸ್ಬೋದು.
ಡೆಫಿನೆಟ್. ಖಂಡಿತ ಕೊಡ್ಬೋದು.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಎಸ್
ಸರ್, ಇದು ಟೈಪ್ 1 ಟೈಪ್ 2 ಹೇಳಿದ್ರಿ, ಧಾತುಕ್ಷಯ ಮಾರ್ಗಾವರಣ ಕಾನ್ಸೆಪ್ಟ್ ಎಲ್ಲ ಹೇಳಿದ್ರಲ್ಲ ಸರ್. ಈಗ ಲಾಡ ಅಂತ ಒಂದು ಹೇಳ್ತಾರಲ್ಲ, ಅದು ಯಾವ್ದ್ರಲ್ಲಿ ಬರುತ್ತೆ?
ಯಾವುದು?
ಲಾಡ ಅಂತ ಡಯಾಬಿಟಿಸ್ ಅಲ್ಲಿ ಇವಾಗ
ಲಾಡ ಅಂದ್ರೆ ಎಂತ ಹೇಳಿ?
ಲೆಟೆಂಟ್ ಆಟೋ ಇಮ್ಯೂನ್ ಡಯಾಬಿಟಿಸ್ ಇನ್ ಅಡಲ್ಟ್ಸ್ ಅಂತ.
ಎಂತ?
ಲೆಟೆಂಟ್ ಆಟೋ ಇಮ್ಯೂನ್ ಡಯಾಬಿಟಿಸ್ ಇನ್ ಅಡಲ್ಟ್ಸ್ ಅಂತ.
ಅದು ಬರೋದು ಇದರಲ್ಲಿ ಆವರಣಜನ್ಯದಲ್ಲೇ ಬರ್ತದೆ.
ಆವರಣಜನ್ಯದಲ್ಲೇ ಬರುತ್ತೆ ಸರ್. ಅದರಲ್ಲಿ ಅಂದರೆ ಈಗ ಇನಿಷಿಯಲಿ ಈಗ ಅರ್ಲಿ ಅಡಲ್ಟ್ ಏಜಲ್ಲಿ ಅಂದರೆ 30 ಇಯರ್ಸು ಹಿಂಗೆ ಈ ಥರ ಸ್ಟಾರ್ಟ್ ಆದಾಗ ಇಟ್ ವಿಲ್ ಬಿ ಕನ್ಸಿಡರ್ಡ್ ಆಸ್ ಲಾಡ ಅಂತ. ಇನ್ಸುಲಿನ್ ಡಿಪೆಂಡೆಂಟ್ ಆಗುತ್ತೆ ಅದು ಅಂತ ಹೇಳ್ತಾರೆ. ಹಿಂಗೆ
ನೀವು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡೋ ಇದ್ರೆ ಅದು ಅಲ್ಲಿ ಧಾತುಕ್ಷಯ ಆಗ್ತದೆ. ದಟ್ ಈಸ್ ಕಮ್ಸ್ ಅಂಡರ್ ಆವರಣವಸ್ಥ. ಮೊದಲಾದರೆ ರೆಸಿಸ್ಟೆಂಟ್ ಮಾತ್ರ ಮಾಡ್ತಾ ಇದ್ರಿ, ಈಗ ಲಾಡ ಹೇಳಿದಿರಿ. ಮತ್ತೆ ಇನ್ನೊಂದು ಮಾಡ್ರೇಟ್ಲಿ ಬಿಲ್ಟ್ ಡಯಾಬಿಟಿಸ್, ಲೀನ್ ಬಿಲ್ಟ್ ಡಯಾಬಿಟಿಸ್, ಹೆವಿ ಬಿಲ್ಟ್ ಡಯಾಬಿಟಿಸ್ ಅಂತ ಕ್ಲಾಸಿಫಿಕೇಶನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ದಾರೆ. ದಟ್ ಈಸ್ ನಥಿಂಗ್ ಬಟ್ ಕಫಾವರಣ ಪಿತ್ತಾವರಣ ಅಂತ ಇರುವುದಷ್ಟೇ.
ಸೊ
ಅದನ್ನೇ ಹೇಳಿದ್ದವರು.
ಆವರಣಜನ್ಯ ಅಂತಾನೆ ಕನ್ಸಿಡರ್ ಮಾಡಿ
ಆವರಣಜನ್ಯ ಅಂತಲೇ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಬೇಕು. ಆದರೆ ಕಫ ಪಿತ್ತ ನೋಡಿಕೊಳ್ಬೇಕು, ಪೇಷಂಟ್ನ ಕಂಡೀಷನ್ ನೋಡಿ ಡಿಸೈಡ್ ಮಾಡಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಬೇಕು.
The concept of avarana is explained in the Vatarakta Adhyaya at the last. But in other chapters, in the previous other things, it is avarodha or avarana, they are not different.
ಈಗ ಬಾಕಿ ಚಾಪ್ಟರ್ನಲ್ಲಿ ಎಲ್ಲೆಲ್ಲ ವಾತ ಪ್ರಕೋಪ ಹೇಳ್ತಾರೆ ಅಲ್ಲೆಲ್ಲ ಅದು ಆವರಣವನ್ನೇ ಹೇಳುವುದು ಅವರು, ಅವರೋಧ ಅಂತ. ಮಾರ್ಗಾವರಣ ಅಲ್ಲಿ ಕಫಪಿತ್ತದಿಂದ ಆವರಣ ಆಗಿ ರಸೋತ್ಸವದಲ್ಲಿ ಅದು ಆಮೇಲೆ ಅವರೋಧ ಆಗ್ತದೆ ಅಂತ ಹೇಳೋದು. ಅದು ಆವರಣ ಆಗಿ ಆಗುವಂಥದ್ದು. ಆಮೇಲೆ ಒಂದು ಮ್ಯಾಕ್ರೋ ಹೆಚ್ಚಾಗಿ ಮ್ಯಾಕ್ರೋ ಲೆವೆಲ್ ಆದ್ದಕ್ಕೆ ಅವರು ಅವರೋಧ ಅಂತ ಹೇಳ್ತಾರೆ, ಮೈಕ್ರೋ ಲೆವೆಲ್ ಆದ್ದಕ್ಕೆ